Alright, so I need to text Holly. She's probably calling for a checkup on, Camden. Oh, I was about to say, don't tell me I can't get out of my house. That would suck. Oh my goodness, I've got the burps. No, not today. God, I would love to do moonshine. That just seems like it would be so fun. Oh god, I have to get her something to eat and drink. Please tell me something's open up here. Yellow Jack is. Or Pit Stop. Okay, awesome. Perfect. Is there nothing open in Oh, Bean Machine. Okay. Perfect. Okay. I will probably go to the Pit Stop, because I think the Pit Stop's a little bit cheaper than the Yellow Jack. Um, 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 um. Oh, where did it go? It's at the... Well... Here I go again on my own. Go down on the road I never known. Please tell me it's not parked right where this local truck is. Well, this is a way to start my morning, but okay. Hello.
Hello.
Okay, perfect. There it is. I do not care if she's hitting that. And really, it would be very dumb of me to snitch, because I did not have a helmet on. There's my helmet. Okay, I was just dumb and pressed my glasses button instead of my freaking thing. Those are still good. Why does it do this? Oh, that's frustrating as all get out. Okay, now, do that. Honestly, today seems like it would be a fun day to drive my Welton around. Because I've not done that in a bit. Just take my bike down to Alta, grab my Walton, drive that around for today. I need to text and see if Ash, that's her name. If Ash is around, to see if we can get that wire out of her jaw.
When I met
Hi, how are you?
I'm doing good. How are you doing?
I'm alive,
Gosh, what happened?
barely. Uh, well, a week ago I got stabbed in my guts by a clown, and then yesterday I fell down a mountain. So,
Oh,
you
Jesus.
know, I'm not having a great time. I lost my spleen.
Oh,
So we have the
yeah.
Tex-Mex menu here. So, like fajitas, nachos, peach cobbler, mac and cheese, tres leche cake,
Oh, okay.
horchata, pink lemonade.
Could I get a peach cobbler and a horchata, please?
Sure can.
Thank you.
Being 90 before tax, can I get your state ID?
Yep. 16257.
What's new in your life?
Uh, not a ton. Just gonna follow up with some patients today, hopefully.
Okay, okay.
Yep.
Any fun cases?
One was a partial jaw replacement. That was fun.
Oh,
Mm-hmm. Which that falls right into my specialty, so
yeah, that's kind of
yep.
perfect.
I
Well, your
was
food is
very
on the
happy to
tray then.
hear that.
Yeah, I thought
Thanks.
about maybe once I get my expungement, I juggled the idea of becoming a plastic surgeon, but I don't have to do paperwork.
Yeah, unfortunately, that's a lot of doctor stuff is paperwork.
Yeah.
Yeah.
Oh well. I guess I won't make people beautiful.
I mean, if you're passionate about it, go for it, you know?
I'll just do the EMS stuff. Then I don't have to write reports.
Alright, that's fair. It's good to see you, Decker. I'm sorry you're not feeling so great.
It's okay. I'll recover. I've got my goth queen taking care of me.
Ah, hell yeah. And, what was it Holly said? A lucky horseshoe stitched in your ass or something?
Yeah, no, I was born with a golden horseshoe betwixt my cheeks.
There you go, that's what it was.
Yeah,
Alright, I'll see you around. Take care.
yeah. Take care.
No, we're about to have an overdose come in. That's great. Dispatch. Radio check 19.
10-2.
Dr. Fera, 1041 Eclipse.
Hi. Welcome.
Hello.
I used to get shot out of it all the time.
If Malcolm doesn't know where the dam is, then Malcolm doesn't
There
really
did
know
used to
me,
be a
because that's where
courtroom.
I lived for a while.
Hi, Indigo.
Hello.
I
He's
Indigo.
there.
Malcolm is?
That's where my brother got married.
Got married.
And that's where my old OG got stuck under the fucking water. He got stuck under the frozen lake.
Oh, it's not the dam. Wait, no, it is.
No, he's on the
You're at the wrong spot.
He's not at the dam. He's on the road down the road from the dam. What is Malcolm doing?
Does he consider that at?
He needs to go up the fucking trail.
You need to go up to the trail. I'm sending you the location.
Who have we lost on a trail?
Theo.
Oh. Oh no.
He's in his sad boy hours.
Oh, I see.
Yeah, that is Mirror Park.
It is Mirror Park.
Yes, it is. Don't not really. That is literally the Mirror Park Dam.
I've never heard it called anything else.
Wait, what?
The dam.
It's always been the Mirror Park Dam.
Yep.
I was like, that's not really Mirror Park.
He was all
Don't
about
say that.
technicalities.
Don't say that. That used to be my home.
Yeah, it used to be mine too. That's why he's all about technicalities.
It is the
I wish they'd
HOA.
open those houses up.
Soon.
Though I can't afford it for like 500K. It's wild.
He jumped off the dam? What?
What'd you say about a house in Mirror Park?
Can't afford what?
A house in Mirror Park.
53164. Yep.
We're slowly but surely saving. Sydney was like, "Do we have a final goal?" And I said, "No, we just save until it's time to buy." I don't have a goal. Just keep on saving, dog.
That's what I'm doing. Trying to do anyway.
I did, and he did not answer. But I didn't just try to call him. I'm on the phone with you.
I'm gonna get out of these heels.
Dr.
Hello?
Fera, how can I help you? Oh, hey, Silver.
Oh, hey. Are you charging me for something?
No, I'm not.
Who the hell is charging me for something?
I don't know.
Okay.
I'm at the hospital.
Who the hell is it? Okay, I'm calling somebody else. Bye.
Okay, bye.
Alright, thank you. Appreciate you. Yeah. Did you tell JJ?
Oops, sorry.
You're okay. Where do
Yeah,
you
yeah,
want me,
no, we're
Doc?
incredible.
Look at that, anything.
Alright, bye. Yeah. Feed my ego more.
How do you want me, Doc?
Preferably
You do,
face
or else
down.
I'll stop
What?
being incredible. I'm only here for one reason, and it's that ego scratch. Yeah, that's basically the same thing. Yep. Alright, I'm gonna stop being a phone girl. Okay, sounds good.
What?
Alright, bye.
I was just coming to the side of the bed.
Hi, Sean.
There's a
Hi.
hold on. I can do this better. I'm sure
How
of
are
it.
you?
I'm chilling.
Yeah.
Trying to get through June without
No,
burning
I'm just
myself out
thinking
too
really
much.
hard.
I can understand. You are a very
I've got a
busy
shit
person this
memory,
month.
It's bad.
Stupidly.
You just wanting to lay on your stomach? Or
You're
you
gay
wanting to be
Santa.
on your hands and knees?
I do be.
I want to be on my hands and knees for you.
Yo,
I
can you
can't
put some
do
pride
that.
decorations at our house?
I just.
Which one?
Hey,
I know.
Sean.
It's Malcolm's house. Or Amber's house?
God.
Okay, never mind.
I got you.
Yeah.
Never mind.
Never mind.
That's your twin. That's your twin.
It's my twin.
Okay, so awkward note. I'm gonna have to pull your pants down a little to look at your ass.
You do you, boo.
Hello.
Hi. I need to get treated before Ember knows I'm here.
Oh, I see.
Oh, shit.
crazy considering she's
Sasha's here.
That's so wild that you need to
What?
get treated before Ember knows you're here. That's
What?
crazy.
Are you yelling right now, Indy?
No, I'm not. I'm whispering.
Oh, I appreciate you.
Yep, no worries.
But she heard me.
What is
I don't know. If she does, she
Sasha's
has super
snitching.
hearing.
Sasha snitching right now. I guarantee is what's happening.
Probably, yeah.
Sasha, you're a snitch.
She just radioed and said she can hear you. So
What?
apparently not.
Hold
He
on.
just went, what?
Scar, that's what's important.
Oh my, what the fuck?
I don't like this.
Oh.
Oakley.
I have her
Oh.
ass out, I wouldn't look.
Hey, Sasha, I can look at you.
I mean, it's a nice ass. You guys can look.
Ember needs to give
but-
me a shot in my ass eventually.
I
Come
don't,
on,
I
it
don't,
looks so
I don't
cute.
want to look.
Yeah, but is it gonna
Wow.
scar?
Happy Pride.
No, I'm gonna have to touch your butt real quick.
Fuck. I need somebody to bite my ass.
Oh, say less. I got it.
Oh, Sasha, get in there.
So
I
Theo
wanna-
was right.
Might.
Theo
I
was right
want to
now.
look at
Clearly.
this.
I need it to bleed.
Wait, actually, I'll do it.
She
Yeah,
wants,
No, yeah, do
she
it.
wants
You
a
need
scar
to.
on her
It
ass.
is so important.
You want a scar on her ass?
You
Yeah,
need to bite
so
really hard.
important.
dude, bite
It's
it.
very important.
I
want
have
to
a scar
her
on my
now,
ass,
so
and
I
she
need one
doesn't.
too.
Okay, so you
Is
want
it a
me?
bite
hold on, let me-
scar?
Yes, bite
Sasha,
her
I'll
ass because she
consent to you
wants
biting
teeth.
my
licked.
ass.
Sasha's not a doctor. She doesn't need consent anymore.
Oh yeah, I don't need consent anymore. All right,
Get in
listen,
there,
I'm-
Sasha. Really
I'm-
dig in. Use your.
Yeah, that's what that was
No,
the plan.
wrong choice
Use
of
your
words.
canines.
Wrong choice of fucking words.
Are you ready?
Don't dig in
I'm
that
so
ass.
ready.
Don't do
Dive,
it.
just dive right in,
Bite,
Sasha. Dive
bite
in.
right
What?
down. Don't let go.
Jesus, Sasha.
Harder, Sasha. Harder. You need to draw blood. There needs to be a
No!
sutures.
Relax.
They need a scar.
Sutures.
She needs some scar.
Are we? Wait, okay, really? Like actually?
Yeah,
Like,
she
Yes,
wants a
yes.
scar on
Off
her
a chunk
ass
of it
to
she's
match her
asking for.
sister.
Come on.
I need to
I'm
look like
so-
fish bit her
Oh my
ass, because fish bit my ass.
I mean, why don't you
Wait,
show Sasha
okay,
yours?
but he's got
and
like a
then-
fucking so. Okay,
Yeah.
Sasha, you gotta bite her with just like your two front teeth.
Tyler, yeah, show your scar to Sasha so she knows what you're doing with her teeth.
Oh, ooh, smart. Hold on.
What did I come into?
I don't like this.
You're buying
I
me dinner.
don't-
I hope you know that.
Yeah, it's gotta look like that, Sasha.
It's gotta look like this.
Oh, okay. I see. I got you, dog. Okay.
Yeah.
Yeah, all right. I got you. Okay, ready? All right. This is gonna hurt, dog. I hope you know that.
Tyler, hold my hand.
I can't. She's gotta see the
Oh,
scar.
fuck.
She's got.
Malcolm, hold my hand.
3.
Hey,
I'm
big
not-
dog.
I'm
Hey,
good over
big
here.
dog. Go ahead.
I'm good.
Please.
You better hurry up.
Malcolm, get in there. God.
All right, you got this.
3, 2, 1.
Ow! What the fuck? Bro,
I'm
that
sorry
was a
about your
fucking
finger.
mean grip. Holy shit.
Is it bleeding?
Hold. Can check. No, not yet. Hold on. We gotta go.
Okay.
More.
We gotta do it one more time.
Again.
She's breaking the bones in my fucking hand.
It's okay, I can take care of that later.
And then I heard you yell.
All right, 3.
Sasha biting her
What?
ass.
What have we walked in on?
She has a.
You're good.
Okay, so he has a scar on her ass.
You're good. She's good. She's
And
She's definitely
she's
bleeding.
trying to have it replicated so they
Okay.
can actually be twins.
They're
This is gonna
twins,
hurt
they gotta
so
look
And now
alike.
Sasha is
Ow.
Sasha bit her ass.
just gonna clean this up a little bit. You
Oh
could
God, that is.
Uh-huh.
you could stop
so
Tyler.
is the scar
on,
that
no, we
this
need-
one has also a bite?
Yes,
Yeah.
fish.
That's why I
So
told
give me a little
Sasha it needs to be her
shut up.
two front teeth
Ass
only.
I was gonna say the problem is gonna be that it's gonna be human teeth, not
No,
dog
that's
teeth.
why
Well,
that's
Sasha's
why
not much
Tyler
different
showed
from
Sasha
her.
her butt.
That's
yeah.
crazy.
I looked at the scar and got a replication of it.
That's crazy.
I stitched it up.
Please don't do it. Please, please.
Do they look
Okay.
similar, guys?
Yeah,
Guys, do they look the
okay.
same?
I'm
Uh,
have a good night.
I'm,
just gonna-
I'm gonna abstain.
I'm gonna.
Yeah, you guys
Sasha,
are good.
does it look
don't
the
worry.
same?
Yeah,
It looks
Yeah.
good.
Okay.
yeah, it looks good, guys. You're good.
Oh, perfect. Thank you.
Can you pull your bits up?
Thank you, Sasha.
Yeah. They're up now. They're up.
I got you, babe. Don't worry.
Thank
Thank
God.
you.
Thank God.
You definitely
Ass
owe me
day.
a dinner after this, though.
Ass day.
Sasha, I will do anything for you now.
Oh.
Oh, say less.
Anything.
Yeah.
I think Sasha has the twins now.
No, I have one of the twins.
Ain't no way.
Wait, I'm confused. What did I just miss?
I could still make that phone call. It's okay.
What phone? I'm missing context again, aren't
I
I?
know. You are missing
context
context.
It
also.
was a
Alright,
conversation
I'm just
we
gonna
had
go
with her
fuck
earlier
myself.
while you guys were gone.
Yeah, as I came down the elevator, I was like, I have the
All right,
twins
I'm
too.
ready for you to look at my hands.
This
You
is
do.
I thought you were gonna say
Oh,
look at my
okay.
ass.
After all
Sorry.
that, you're good?
Yeah, we're good now.
Alright,
You can-
cool, come this way.
Yeah, sure.
What a successful day, guys.
Honestly, I accomplished all my goals. for the
Okay,
day,
so what's up with your fingers?
I picked at the skin again.
Sasha.
True.
I can't help it.
Sasha, do I need a rabies shot?
Why would you
What?
want a rabies shot?
Ah,
I
good.
don't know, because my sister needed one. I had to double check.
No, I'm human, you dumbass.
Wait, but I need her to feel the pain.
You're a
first.
gremlin.
No, that is
So
not
are you,
how it works
bozo?
either, Sasha.
Wait, what did I do? Hold on. Can you come over here? I can't hear y'all.
She got bit
Were
by-
you okay? What did you just say? I'm a human. Why'd you just say that?
She said, do I need a rabies shot? So I said, no, I'm a human.
That's not how that works either.
Wait a
If you
minute.
have
You
rabies
are a
and you bite
doctor!
someone, you are okay. Oh my God.
He was
Oh
a
my
doctor,
God.
Sean!
You know what? She's a doctor for animals now.
No,
That doesn't
but
make
like,
us any better.
Nope.
I haven't been bit. Okay, I can't make this any better.
The
I
human
don't know.
rabies shot is reactive. The animal
Yeah.
rabies shot is preventative.
Oh, I
I'm
don't.
gonna go check.
Yeah, I don't know anything about rabies. I have only had to give one rabies
You're
vaccine in
gorgeous.
my entire.
And who was it too that you didn't know what the vaccine was doing?
I was just told to give a rabies vaccine.
Were they
man.
Oh, you
showing
were
signs?
told.
Because even if you gave them the vaccine, they were gonna fucking die.
No, they just got bit.
Oh, okay, good.
They just got bit.
That's the crazy thing about rabies is if humans start to show signs of rabies, they're already dead.
No. We did have a patient a long time ago back in Zona where
You guys are not standing the same way. I don't believe you're twins.
Sister.
Here you go.
That's wild.
That's insane, actually.
I don't even know which one is gonna get on their knees for me right now.
Me.
Oh, okay.
Well,
With no hesitation, it'll be me.
well, there's
Okay.
there's a little hesitation because no, it's
Okay, well, I was gonna take her home first, but
Oh, okay.
I mean, yeah, all right. Hey, Indy, are we good? I gotta go home with somebody.
Yeah, I already bandaged
Notice
you
the
up. Your
one who
gloves are
said
back
she
on. You're
wasn't
good to
gonna
go.
hesitate to kneel is the one
Wait, are
that
these
didn't
new
kneel
gloves
at
or are these
all.
bloody gloves?
New ones,
Right,
new ones. I
right.
grabbed you,
It's not, it's not
grabbed you a
even that
fresh
she,
pack
not
from
even
right
that she
here.
hesitated. She straight up didn't do it.
So wild. Yeah, all right. What a wild.
Sash.
Ah.
I'm sorry, Sean. I didn't intend to put you in the middle of that, but
yes.
You know
She
what?
called
It's
your name when we
fine.
needed you, and then we really quickly didn't need you anymore. I'm very
It's
sorry.
fine.
76
Yeah.
What did you
Yeah.
say you needed him?
She needed help getting on her hands and knees, and I didn't know how to help
Everybody
her.
stay here.
I was
So you think to ask me?
Sean, I don't know.
Ain't no way. I mean, valid.
How often do
Valid.
you get on your hands and knees? eh?
Extremely valid.
Tell me you don't know.
Are you saying that Sean is a professional being on his
Extremely
hands and knees or
valid.
something?
Professional.
We all gotta be good at something.
God, I'm good. Yeah, okay. Oh, I'm good at something. Oh, this is the first time I bit someone's ass in a hospital.
I've been on my hands and knees a lot this past couple months.
Good for you, Sean.
I'm so
Good
glad
for
for you,
you.
Hey,
Sean.
yo! Oh, Christ.
As
I
long
mean,
as
even
you're
Sydney
having
had her
fun.
priorities. When she was being carried away after surgery, she goes, "We can't have sex tonight."
That's
I told her
crazy.
I told her
was
she
like,
had to take it easy.
Yeah, I was
So
like,
it's your fault.
Just to have Sydney be
Look,
the pillow princess, easy.
If I
here's-
told you
here's
what
the thing.
happened, you would agree.
Here's the thing.
So.
Sorry if this is TMI, Sean. Every time we say to each other, "Oh my God, we're gonna do this tonight," every time we make plans, something happens.
Did
And
you
sure
make
enough,
plans
today we made plans.
Oh no. Oh,
That's
Ember.
why
Sorry.
at one point she was really sad because she was like you don't do this anymore, and I was like, because every time we do something happens.
We're geeky, man. You just got
Look.
blocked for him.
She gets to go home tonight, Sasha. So
Yeah, she
you
gets
can't
to go
be like
home.
That's
you can't
fair.
be like that to me.
You know,
She can't be I don't know.
listen, anyone can discharge themselves. So
Uh-huh.
I
why
don't
would you say it
like.
like that?
The twins has gone
I
missing.
don't like how that was said after the conversation of sex was just had.
I know that's
don't
what I
like that.
said.
Yeah.
Uh-huh.
I wasn't gonna say it. I was like,
Oh, I completely that went
I
over
don't
my
like that.
I know.
I don't like that at all.
way over
That's
my
why
head.
I
That's
literally said,
gross.
uh-huh.
I was completely thinking
not the
medical.
gross, not even gross. It was
That's
gross.
gross.
Close.
Yes, gross,
Jesus.
gross.
I was thinking medical. I'm sorry. I switched to medical brain for a minute.
That's crazy.
Uh-huh.
Hello. Hi.
Oh my god. Stand up.
Hi.
Stand up. Stand up. Stand up. Stand up. Stand up. Stand up. Oh my god.
What just happened, Sean? Did you have some PTSD or something? What just happened?
Flashback, Sean.
What happened?
I need to put a different hat on real quick.
These last couple of months been really, really fun for you, have they?
I just had to take off this human hat and put on another hat real quick.
Why? I'm so confused.
You'll understand when you're older.
I don't know what that means, Sean. You
I
can't
really
do
love
it.
being administrative assistant.
I'm confused. So,
Speaking of-
anyways.
There you go.
Anyway.
Yeah, you hungry?
Anyways, guys, hey.
Hey guys,
Oh
how's
my
it
God.
going? Funny
Sorry,
seeing you here.
sorry for that. I really just needed to get on my knees for Sasha.
That's crazy.
You know?
I'm gonna enjoy this.
Sometimes you just need to get on your knees.
Yeah.
That's true, yeah.
There's a few people
Oh.
I'd get on my knees for, and 2 of them are standing in the circle.
Yo,
Who's the other
same.
one?
I have a
Ember.
super answer. Oh, okay.
That's fair.
In unison, they answered.
They really answered in sync with that one.
Yo,
That was
it's already
crazy.
been decided if anything happens to Malcolm, I get Ember.
That's amazing.
That's in the will.
Yeah.
Gonna get that notarized by a lawyer.
But wait, I get my. Oh my God.
Technically,
Y'all-
doctors can make wills, can't they?
Oh,
Yeah, or
I think,
mortuary
yeah.
services.
Ugh.
Just
Oh,
need to
Ember,
call
I
it
asked Sean if
Peterson.
we can get pride decor at the house.
I'm Malcolm
yeah.
Stratum of
Just
sound
bring me.
mind.
Look, Malcolm made a joke the other day about a threesome, but he didn't specify it had to be another woman, and then he hated Winston for it.
What? the-
Listen, I'm just saying, we can put Malcolm in the cook chair.
Oh, I
Yeah.
cucked somebody
He also didn't
before.
say he had to be involved, so
I
true.
could never
Yeah.
be in a cock chair. I could never.
I
Mm-mm.
cucked Ty Slaughter.
I hear a lot of people did.
Yeah.
Yikes.
Yeah.
That man hit on me 3 times in one day because he didn't
know what's
realize I was
funny?
the
To
same
keep forgetting.
person.
You know what's really, really funny about Ty?
What?
So he used to have a Bowser. And when I say a Bowser, like I'm talking about somebody like he could not like quote unquote conquer
A
and sleep
Bowser?
with. Yes.
What the
So,
fuck?
well, she was referred to as Bowser because there was no way in hell like anything was gonna happen. So like she was basically the impossible boss because Bowser's like an impossible boss.
Yeah,
so
yeah,
they're dating
yeah.
them and like he always comes back.
I love that.
So, eventually,
It's
when he
376
did
Eclipse
end up
Medical,
sleeping with
147
her,
Dr. Samimus.
I
Bring him 147
like, around that
unconscious,
time,
blunt
was
force
also
trauma
being
to the
hit on
torso.
by him. It was around Christmas, and he
Probably
he
like
wanted to sleep with me
something
so
collapsed a
bad. I'm
lung
talking
or punctured a
so
lung.
fucking bad. He was thirsty. And I
10
was
4, I'll
like,
go ahead and take him in the OR when you get here.
nah, you need a new Bowser. You need a
Copy.
new Bowser, and it's gonna be me. Because I'm never going to sleep with you ever. Ever.
That's so funny.
And I refuse, not because like I don't want to, because I would 100%, but it's because of the fact he needs a new Bowser.
It's so funny. Sloan was the one that asked me for the threesome, and I was like, yeah, but Ty has to sit in the fucking chair.
That's so funny.
Yeah, yeah. She rolls up to Zona, for no reason except, and gets out of her cop car because she's on duty. She's like, "Hey, you want to sleep with me?" And I'm like, "Sleep with me and Ty." And then I'm like, "Ty has to sit in the chair. I'm not dealing with him." She's like, "Yeah, okay." And she calls him and tells him, and he's like, "Sure." It's why it was.
Sasha
Oh.
was the topic of conversation for a couple of threesomes for me, but when I finally did sleep with her, it was just us.
That is true. Mm-hmm.
That was wild.
I also slept with my brother's girlfriend before she became his girlfriend.
Damn. Which
You could do
one?
it again.
Annie Weber.
Oh yeah, so I'm just saying you could probably do it again. Outrageous.
Sorry.
Is John your brother?
John? Who?
Jonathan?
No, 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 no.
No,
Oh.
but way before Jonathan. Way before Jonathan. What?
Ground floor out.
Oh, it's good. Sasha really dug right into him. Oh wait, hold on. I gotta go with the
I started him on Cadillac and TXA.
Alright.
In case he's bleeding internal. And then I just have him on an oxygen mask.
Gotcha, gotcha.
Just get
Andy,
the
do you
other
need
hooked up here.
assistance in the OR?
I might potentially. I'll need to grab a quick scan, see if there's any internal bleeding, then I'll let you know.
Just lay him out better for the scan for you.
Yeah, appreciate you, Sargon.
Thank you.
Mm-hmm. Alright, let's grab a quick little ultrasound of the chest here. We're just going to check and see if there's any internal bleeding going on. Alrighty. I'm seeing a couple fractured ribs on this left side here. And about a mid-sized puncture to the lung. Alright, this should be hopefully a simple enough fix, but we'll have to clean and make our initial incision, go in, see if there is any bone inside of that lung that would need to come out. It looks like it's a wombo combo of broken rib punctured lung. If you want to assist, you're welcome to.
It's 100% your call.
Oh, it is actively collapsing, okay. It's a full, I believe a pneumothorax. I might need your assistance.
Alright, I'll just change in the OR.
Alright, let's get cleaned up.
Make sure he doesn't die, please.
Alright, so we have an actively collapsing lung on the left side.
Make sure you relieve the pressure before you cut them open.
Yep.
Sorry, it's habit for me to do that with
You're good.
pneumos.
You
I
are
apologize.
perfectly fine. I never mind extra notes during surgery.
Yeah. Where are you at with everything?
I've just cleaned the chest prior to making the initial incision. Haven't inserted yet. Just finished up ultrasound to kind of figure out what was going on interiorly.
Alright. Hey, do you want me to go ahead and insert a chest tube while
Yeah,
you
sure.
work on the lung? Alright.
Sounds good to me. My main concern is I'm missing a little bit of rib, so I think it might be inside the lung, but I've not been able to get in and look.
That's fine. I'll just drain all the fluid from the chest. That way it makes the easier to see. I'll follow with suction and suction some of the fluid out of the lung.
Yep. I just did a ding dong. I'm not going to be able to be a doctor for very long today.
Do you want me to be with y'all for the meeting?
If you want to. Pendragon's usually a lot later, so...
Yeah, I know.
He texted me super early. I wasn't even awake yet, so...
Oh, okay.
Yeah.
I usually see him in the evenings about midnight-ish for me, so...
Yep. I mean, if you want to be there, I'm down to have anybody there. Because he probably wants to talk to me about the blood sample thing, which I still need to get done for myself.
Yeah, I would like to be there if that's the case, and I can do your DNA. Is that if that's what you're talking about?
Yep.
Yeah, I have the swab test in my pocket.
Perfect.
I've been trying to ask and make sure everybody's getting that done as I go.
Mm-hmm. Yep. I've been on duty like one time since the word went out to get it done, and it was a hectic shift, and I just forgore. Yep. Okay, yeah,
Looks
there
like
is
it's
a
just
little
sitting right
piece.
there.
Yeah. I'll just get a little pair of forceps in here, we'll get it out.
Perfect. I'm gonna prep a patch over here just in case it's needed to repair the lung.
Yeah. When I was looking on the ultrasound, and now that I'm kind of in here, it was kind of a mid-size, so probably a patch would be good to do. Like a sedan, it's mid-size.
I thought Malcolm watched me walk in here. Now he's calling me.
Yep. That is how it is. Alright, I've got this piece of bone out of here. If you have the patch ready to go, we can start getting that, put in place.
Here you are.
Thank you much.
I didn't want to take over and just do it. I just prep it for you.
You are all good. Honest to God, I don't mind.
Got the weirdest call earlier. PD called and told me that one of the patients that I was originally told was in custody was not in custody, and then he called me back like 10 minutes later saying, just kidding, she's actually in custody.
Oh, that's great. That is weird.
Like, well, but you
Switch
shouldn't
double
wake up
tree,
and leave.
76 Trauma Center, 1042.
Alrighty. I've got this patch in place. Let's check and make sure he's respirating as he should be prior to closing chest incisions. Actually, I have 2 broken ribs I need to fix. Where is my head today?
Yeah, I'll do a pressure test while you're prepping the ribs.
Sounds good.
I also need to quit food as soon as we're done here so I don't pass out.
Yep.
Alright, looks like the patch is holding well.
Nice. I'm gonna give a secondary glance over these ribs here. I need to see if they're kind of jaggedly broken, if they're clean cuts, kind of what's going on with them.
Yeah, I would assume that one with a shard you're gonna need to use the ever famous bone cement.
Yeah, more than likely.
Alright, just so that I don't pass it on you in surgery,
Yep.
I'm gonna...
You're all good. I can take care of the ribs.
Okay, I think I helped you through the hard part. Just don't... actually, before I leave, I'm gonna remove the chest.
Alright.
Just put a little tiny bandage on him.
Yep.
Alright, I'm gonna leave him with you. Holler at me if you need anything, but I'm gonna just go grab a snack from the vending machine.
Yep, you're all good. Alrighty, we've got bone cement on this first rib, all good to go. Let's get this second rib set up. Alrighty, it looks like everything's cemented back into place. I'm gonna give one last little look over here before I fully close the chest back up. Just make sure there's nothing else going on. Alright, everything looks to be all clear. So we'll go ahead and get his little IV of anesthesia and things out of him. And then, Dr. Nancy, I'll take your consult. This was a fairly quick fix. I'm assuming this patient might come out of it pretty soon and kind of go on their merry way. However, if you believe that they need to be in observation for a bit or ICU, please do let me know. I'll listen to ya.
Alright, I'm gonna change back out of my scrubs now that I'm not about to pass out.
10-4. Alright, just a little bit of observation until they come out of anesthesia. Sounds good to me. Alright, we'll go to the observation ward and let this person come on out of it.
Can I do it for you?
Something tells me she would like that. Actually, don't throw
boy.
her off a mountain. Throw her off the Vinewood sign. I think that's never mind.
Okay, that's
Oh, okay. I mean, that's
fucked
more
up.
accessible, I guess,
Sorry.
but not as high.
That's fucked up.
Sorry.
of you.
Sorry.
I hope you know.
What's the problem?
But that's so fucked up of you.
Oh, do you have a bad history with the Vinewood sign? What's wrong?
That's fucking
I wouldn't do that if I were you.
Sean, I hate you.
Alrighty, there we go.
Damn, I guess if you don't like the Vinewood sign. I think it's kind of nice.
Oh no, she doesn't have trauma with the Vinewood sign.
A little
She
rickety
doesn't.
maybe, but
I don't
like,
think she does. Sorry if you do.
Uh-huh.
I don't
I
really
have
know
heard
her.
a lot of people have fallen off it and died.
Yeah. An old friend of mine used to just fucking jump off of it and fall off it all the goddamn time.
There was somebody who shot me in the back of the head
Alrighty.
because I lived rent free in his head, and then he fell off it and died a little while later.
Do you remember
I was
Merrick?
like,
Just real quick
yeah, that's
for
what I'm
my own
talking
medical
about.
report.
Oh, that's right.
Dr. Nancy,
That's
do you
right,
know
I
this
forgot he
person?
did
Have
do
we treated
that.
them before?
Yeah,
Would we have them
yeah.
on record?
Yeah, he did do that.
Yeah, and did I ever tell you what he said to me before he did it?
Hmm.
This is for everything you've done to ruin my
7115,
life. And I
okay,
said to
thank you.
him, I don't even think about you. Because everything that had happened to him happened while I was asleep, and I had no fucking idea any of it had happened.
Oh, that's so. Oh my god, you're right.
Yeah.
Sorry, I was like about to pass out.
You're good. Everything's looking alright. I was just getting the medical report started up while we wait.
Okay. I assume he's waking up.
When I consulted with Dr. Nancy, it looked like just observation until they come out of anesthesia.
Casey Michaels, someone please open
Ah,
plane
okay.
dealership. I want plane.
I want to open a dealership. but not for
Remember when you
planes.
can buy planes and airplanes and shit, but they were like
What's wrong with
$30
him?
million.
What happened?
Jesus Christ.
No one needs a fucking plane.
I hate
Just
to
rent
be that
one.
kind of doctor, but I can really only tell Miss Monroe right there. So
What?
she would need to give permission.
Sasha,
Huh.
I need to go over his medical records with you.
Hello, my love.
I'm here.
Still at
Come
the
over here.
hospital. We just been
Yeah.
shooting the shit, and then while we were doing that, Sasha's brother.
You're the only person here on his emergency contacts, so you would just need to give me permission to
Yeah, that's
speak
fine.
on it. Okay.
Damn, that's crazy. He didn't put me on.
Can you
emergency
share his medical
contacts.
records with me? Or the medical report, sorry.
Yeah, I can.
Thank you.
It's not done by a long
Yeah,
time.
yeah, of course.
Okay.
What's his state ID?
7115.
Yep. Sorry, hun. What's your name? I might have accidentally skipped over you on the ECs.
Tyler's on
Tyler
here.
Jenkins.
Oh, yeah, you're on here.
Oh.
Swear to God.
But yeah, came in 2 broken ribs, 1 rib punctured the lung. We were able to repair it with a quick patch and then repair the ribs as well. Everything's looking good.
I know, right?
Alright, thank you.
Yeah, no worries. Alright, I'll get that written up as soon as I can.
I was like, oh yeah, we're still at the hospital just chatting. And
Can,
she was like, oh, maybe.
Yeah, what's up? Can I have
Maybe
Ellie
staying
here
there
kinda
for
observe the ICU
the rest
check?
of the night. It's a
Yeah,
good
sure.
idea until you're ready to come
Hell
home
no,
and
I'm
go to
not staying here
bed.
for the rest of the night.
No, I think
So
it was just
ours
the
aren't as
implication of,
thorough
you know,
as a doctor's are,
until you're
but
ready to
it's
come
still
home
good
and just
to
go to
kinda
bed.
see how it goes.
Maybe
And then I'll
just stay.
after the fact kind of explain things.
But no, we're definitely not staying here at the hospital. We've just
Alright,
been
vitals
tracking
are looking
conversation.
stable. Let me take a look at this report here.
Because I'm amazing. I'm just kidding.
So, if you want to pull up your MDW and go to your dashboard, find Martin Pierce.
I've been spending
on
most of the day
ICU
enjoying my new
dashboard,
car.
and then open his report.
Oh,
Alrighty.
yeah, I saw some people in rainbow cars around town.
Hell yeah.
I would
Was
like
us. I'm calling my car the love bug.
I love that.
Because
to
it's
check
got love on the
over
side of it, and also it's
the
basically a
torso.
Volkswagen Beetle, so. A love
So,
bug.
basically, you look at the report.
Just
you
gonna
review the
double
injuries.
check. There were no initial signs of internal bleeding, but I want to take a quick ultrasound, just make sure that's still the case. Oh, shit. I forgot alcohol. Alright, everything internal is looking good. All this bruising's healed up. None of the lacerations look potentially infected or anything like that. Vital signs stable. So the only other thing I want to take a look at that was brought up as a concern here is that little growth, which I'll have to go take a CT for.
I need to remember to renew my license before we go on our
Alright, I'm moving to the CT room. If y'all want to come with, you're still welcome to, of course. Yep.
Yeah, so basically, when going through an ICU patient, you want to review the medical report. Here, do like a vitals check. And then Dr. Nancy will
There we go. We'll lay him right there. Alright. Since this is a growth, I believe last time we did a
But yeah, so what the doctors use a little bit more thorough than
potential CT, so what I'm going to do is remove the metals from him, and let's do an MRI, see if we can't get any further imaging on that.
Nancy tells you to note down, basically. And then you just put that all in the notes section.
Let me double check there's nothing on his profile that makes him ineligible for an MRI.
Well, yeah, if they're awake, it would be us. It would be our job to try and
Yeah.
contact with someone.
Okay, nothing noted except for the glasses,
They aren't supposed to be, I should say.
which I have here, so that should be all good.
Contact PD for them, usually. Is he conscious, by the way?
Hasn't spoken to me, still unconscious.
Okay, just checking. That's what I
Yeah,
thought.
you're all good.
Yeah, so generally speaking, you'll contact PD if they have that contact PD tag, or if it says they are in PD custody. So if they are ready to be discharged and they are in PD custody, you need to contact PD because they're not allowed to go on their own. They are detained.
Yeah. And so that also means no ECs, right?
Sorry,
repeat that?
It also means no emergency contacts.
Yes, for PD custody. Yes. If they just have like contact PD, if he's like they were the victim of something, or PD has follow up questions, you can still contact their emergency contacts and whatnot.
Okay.
Sometimes they'll like say, hey, like Dr. Nancy will say, hey, patient's open for visitors, or they're not. It all just honestly depends.
Yeah.
But let's see here. That's really
Okay.
all an ICU check is.
Okay.
You just kind of note down what you observed.
Alright, I'm just gonna return these medals here.
Let me see if I can find a good medical report that I've.
There we go.
Oh, I know.
So at this time he's still unconscious. Considering there's a lot of folks in the observation ward, I'm probably going to move him to one of the ER or the private rooms.
Okay.
That way we can just kind of focus more on his care.
Yeah, that could have been postponed.
I might need to yap with you for a quick second if you're free.
Okay.
Get you a little bit more comfortable bed. Okay, so there's a few things I need to look over this scan just to make sure everything's notated here.
You said you needed me now?
So have you looked at Martin Pierce's ICU paperwork?
Yeah. I noticed there was an abnormality on one of the scans.
Yes, there are 2 small spots. I did an MRI. They appear to be tumors. Potentially cancerous.
Alright, did we do a full body scan?
I just did the head, but I can redo for the entire body.
Yeah, if we can get a full body scan to make sure there's no signs of anything anywhere else. If not, they can possibly be surgically removed, but we'd need his consent on what he wants to do.
Yeah, exactly. That's what I was thinking. Which at the moment he's not conscious and with us.
Yeah.
Just doing the follow-up. But since you are our resident brain doctor, I figured I would ask your opinion.
I don't want to let it go unchecked, but we need to do a full
definitely.
body scan with contrast to make sure that there are no signs of it anywhere else. If not, hopefully he wakes up soon and we can see which option he wants to go with as far as treatment.
That sounds good to me. I'll run him back to the CT, the imaging room.
Yeah, just make sure to check his make sure to check he doesn't have any allergies to the contrast, because sometimes some people do.
Yeah, I looked over. He doesn't have, as far as I can see on his report, medical records, any allergies or anything like that, so in theory it should be okay. Alright, I'm gonna take him for that secondary imaging, and then we will go from there.
Alright, yeah, just let me know
Will do. I'm sorry to keep pulling you into something.
No, you're fine.
Yeah, Ember should be a chief over Indy. She really should.
Because every time I show up, I'm just like, ugh. Yeah, I mean, if you want to be around every day, I'd say, since you're, oh, sorry,
You're
since you're
good.
still in training.
Alright, let's start up the IV line. We'll get some contrast in there. Alright, we're going to push just a little microdose of this contrast here. And I'm just going to monitor him for a minute to make sure there's no allergic reaction. And then if there is none, we can proceed with the scan. Do a full body check for any other abnormalities like were found in the brain. Alright, I'm not seeing any swelling or itchiness, redness around that injection site here. That looks good. We're going to go ahead and push the full contrast and we'll get started. Alrighty. Alright, we've got this full body scan going. Might take a minute or two to go from head to foot, but we will have our results here shortly. Okay. On right side of brain. Alright, that's got the full body scan done. Alright, that doesn't look like there's any other spots. It looks like there's just the two on the right side of that brain there. Alright, we'll just get that out. And we'll transition back to that, ICU room.
Cinder, more cinder. I bet cinder's.
Alrighty, here we go. just get those IV bags back up here. Alrighty. Let me add this note to the medical report right quick. Actually, prior to that, Dr. Nancy, is there anything else that I should be doing for this patient that you can think of? Do they feel stable enough to, have visitation, or would it be better just to let him rest for the time being? Okay, I can definitely contact the ECs and let him have visitation for a bit. How is it spelled? P-I-E-R.
Yeah. If Cinder wants to, I have 2 patients that would like to be comforted by Cinder.
You wanna come? Oh, okay. I think that's alright. Wanna go comfort people? Let's go.
You're not in here. That might be her room.
Alright, ECs have been contacted. That the patient is currently unconscious but stable enough for visitation.
Hello.
Right. I'm gonna hang a little bed alarm right here. So that if any vitals things start popping off or anything like that, I'll get a little 611 for it. That way I can come back and assist the patient in any way necessary. I'm just going to go quickly work on this report. Dr. Nancy and Nurse O'Connor, please feel free to let me know if anything
No, it's just not her.
changes with the patient.
Sorry. I saw her walk in with a fucking helmet and I had to pause.
No, your patient's Ash is here now.
Okay.
Sorry.
Did Theo... Has he
He's
woken?
still unconscious.
Still unconscious, okay. So I'm
Yeah,
gonna
but
put
he's
him
got people
in...
back there.
Got you. I'm gonna put him in full observation for the time being, then.
Yeah, I put the note. I put the little tag on there already.
Perfect, thank you.
But I didn't fill out any of the rest of it because I was asked questions.
Yeah, you're all good. I am going to toss this note on Martin's thing, and then I will see Ash.
Okay, I'm gonna sit back there with Theo and write this report from my earlier surgery.
Okay.
Is any of y'all available to sell me a few med kits?
Yeah, give us just a second.
Alright, thank you.
Just normal med kits?
Yes, ma'am.
You want 3 again, or how many?
Just 2 this time.
2?
I gave
okay.
all them away.
Yeah, give me just a sec.
Okay, thank you.
Alright, out of it.
Oh, that's wild.
Good night.
Right.
Sure.
Wrong sister.
Where's Hannah?
Night.
Oh, no, we're just happy.
Oh.
Hey. Oh God.
Is that Ash? Okay. You're looking just a little bit nervous. I think I might know why.
Indy.
Yes.
Whenever you get a second, if you want me to go ahead and do that swab, I'm gonna go talk to Nora real quick though.
Okay. I'm assuming it's because of the wires.
Hi.
Okay.
Let me
How do I handle this?
If he's awake, we do need to contact PD, so just let me know and I can do that.
Right now, I cannot. No, ma'am. Right now, I just see you and our nurse Charleston over there.
Dr. Fera, the patient that we were doing the scans on woke up. Do you want to be with me when I speak to them, or?
I would like to. I'm currently dealing with a separate.
All right.
Yes. Are you referring to me or to him? Okay. Would you like to be in a quieter place, or would you prefer to be around people? Okay. I can come talk. If you need a quiet place, you can always stay in that little patient room, okay? Just text me if you need anything, and I'll come help as best I can.
You have time. I can contact. I gotta contact PD anyway. So if you want to deal with the other concerns first, up to you.
Okay. Let me see.
Okay.
Alright, there's things that need to happen with that patient before they even need me, so. if it would make it easier, we definitely don't have to do the wire removal today. I was just going to take a scan to kind of see how you're healing. If the healing is taking longer, the wire would need to stay in anyway. And if it's looking good, we could maybe schedule something out, maybe so someone could be here with you, like Maisie or somebody else you're comfortable with. That way maybe it's not so much a all at one time this is happening thing. Do you think that would help? Since the court case. The big, I'm assuming the big court case. Oh. Well, I'm sorry. I don't know how to help. I know.
Are you available?
Unfortunately not at the moment, no ma'am.
Okay. Let me.
I'm assuming Theo woke up?
Yeah, and he wants to go.
Okay. He doesn't have any IVs in him or anything. He's free to go whenever he feels like it.
Okay, is there anything like... I mean, I can call Ember to have him...
Ember's currently with the patient as well, at the moment.
Okay.
If he wants some pain medication, I can help him out in a little while, but, I currently am with a patient, so this is what I need to focus on right now.
Yeah,
Sorry.
you're good. No, take your time.
It's okay. He was just in recovery waking from observation. He's not severely hurt. So would you like to get that scan done to see? Alright. So here's my question. Would you like some medically prescribed uppies, or would you like to walk under your own power? It's up to you. Okay. We're just gonna walk to the x-ray room. I can place you on the bed if you need me to. Let's see. We have some spare jackets and things in the doctor break room. Unless you want to do the scan first. It's up to you. Okay. We'll do that right quick. Sorry, we're just running to the break room for some spare clothes. Okay. Now we'll get the x-ray done. Hey Maisie, we're just grabbing a x-ray. You can come in if you want to.
Okay.
Here we go. That should be all good. We'll just position this. And I'll just get a couple different scans. Alrighty, so we're gonna do one to the left side, one to the right, and then one straight on. Just so we can get imaging all around. Alright, that image is coming through clear. Let's go ahead and get the right side. Alrighty. Then last but not least, we're just going to do one straight on here. That's pretty good. Alright. You can hop up, Ash, if you want to. I've got all my stuff right here. Alright, so it's looking like your bone health has increased pretty well, which was kind of expected. I mean, if you count regrowing your own bone pretty heckin' quick as a superpower, I would say so. If I had to get this on a scale of 1 to 100, I'd say your bone is about 81 to 89% regrown, which is exactly what we were looking for. So here's where the question comes. I would feel comfortable. Yeah, I know. We could do that today, if you feel up to it. If not, we can always wait and maybe do a procedure with, maybe some light sedation or something like that to, help chill the experience over. I would like to wait till the bone's completely healed to, put in any of the false teeth. So that'll need to wait another couple days until our next set of scans, but things are looking good. So whether or not to remove the Yeah. Alright. If you're good with it, I'm good with it. So, I get that. It's something I can just do in the ER. I would just need to, remove the bracketing and the wire itself. Okay. There we go. Oh, sorry. Here you go. Pick whichever bed you'd like to have.
Alright, JJ. Alright, that team will start setting in very quickly. And I'm gonna give you a nice bed to put on your shoulders.
Alrighty.
Here's this for you. It's got a little strap on it.
Have I been
Honestly,
threatening his life?
true.
Wrap it around your arm. And it'll sit
Why
on
would
your
I be
shoulder pretty well.
threatening Percy Weaver's life?
Alrighty, so
No.
I've got just a little bottle of solvent here. Basically, that's just gonna take the little tooth glue I used to put those brackets on,
His life and threatening my
and
twin sister?
kind of release
I
it.
posted something the other day
It
about,
might not
like,
taste the best,
the-
but it
how
gets
I
the
didn't
job
agree
done
with
quick.
the death
It's
penalty
not
ruling
toxic
for
or
the
anything,
DOJ,
so you
maybe
should
he
be all
thought
good,
that
but
was
you might
about
want to
him.
rinse your mouth out after.
Why hasn't he come to me personally if he thinks I'm
sorry,
threatening
Alyssa.
his life? What the fuck?
Yeah, you can.
Yeah.
It just don't taste that good.
Oh,
Alright.
if he wants to fire me immediately after me getting hired, that's fine, but I better expect him to come to me like a
Can
man
ya
and figure out what the fuck is going on.
give me a big old toothy smile right quick and we'll get this wire snipped.
Is he confusing you with someone else?
He says that someone named Laszlo is threatening his life, and I have literally never fucking threatened his life. And unless he wants to scroll through my Twinster profile and find me the specific post he thinks I made where I threatened his life, then...
There we go. Alrighty. Keep that big toothy grin for me.
Am I gonna have
I
to
know,
sue
I know.
Percy Weaver?
We're gonna get a little bit of solvent on here and let's get these brackets off.
Well, I would, but if he thinks that I'm the one who did it and he hasn't even reached out to me about it yet, then that's weird. I was literally in his courtroom today. I've been in his courtroom. Just sitting off to the side with Niles. Great, now I'm gonna have to look through my own Twinster in case I
Alright.
accidentally threatened a judge's life.
There's our 2 canine brackets gone.
Was that Parker that just called you?
No,
And
this
that
is Parker
molar
on the phone
gone.
with me, claiming that Percy says I threatened his life, but
That
also I'm pretty sure
bracket
this isn't the same way
gone.
he thinks that
Just
Franklin
got 2
threatened
more.
his life, so...
Alright. Secondary molar.
I said the other day about
You
the
got
ruling
it,
about her
you got
death
it.
penalty, complete
And
and
then,
total moronic
last
decision.
one.
Whoever
Boom,
made
we're
that
done.
decision should be ashamed. Jesus Christ.
We are all good, Miss Ma'am.
You want to teach Fera a lesson, kill her quietly and without anyone
You did
knowing.
fantastic.
If you're dead set on killing her, don't do that shit so publicly and treat it like an art exhibit, Jesus. And then...
I'm sorry, I know that was a lot, but you did do genuinely
all
great.
in all, I'll say is that if you're going to start an argument on Twinster that you can't even properly fight, learn
Do you
to
wanna
spell
rinse
the
your
word
mouth out right
embarrassing
quick?
before attempting to defend yourself. That was about him.
'Cause I know that solvent
does he
isn't
take that as threatening his
the
life?
most fun flavor.
Because there is no verbal threat for
Okay.
his life in that sentence anywhere.
He must be confusing.
Alright, everything's looking great. I'll just want to do one more set of scans in maybe 2 or 3 days. Make sure that bone's fully healed through, and then we can get the false molars
Not even sure he'd
and
be
get them
able to
put
pull
in.
up a specific example.
Okay.
No, that's okay. You didn't know. I'm trying very hard to maintain my composure right now because what the fuck. Okay. Let me see. So 7 days ago when the death penalty happened.
Anytime, sweetheart.
I retweeted at Birds Sucks a sad reality. It's at Minx WY or MYNX. A sad reality in our city is that it's filled with violent criminals and murderers that walk the streets still. Some of you applaud them even. We clearly have selective outrage on the topic. I'm anti-death penalty. Retweeted at KBanana. We behead people like it's
Alright,
fucking
if you have
normal.
any
We commit
questions,
war crimes like
please
fucking
feel free to
terrorists.
call or
These
text me,
actions our
okay?
DOJ take are always making light of situations and is an insult to the victims. I said, stop trying to make her fucking execution an art show for your personal enjoyment, you twisted fox. That's not what this is about. Retweet at Kiki. You're not a bad person for having a DID or another mental disorder or disability. You're a bad person.
Alright, let's get this taken care of. So I have now 4 other things to do.
Yep.
To murder, and please do not generalize the disorder.
There's shooting going on up in Plato, and people injured apparently, and there's also shooting going on down south with people injured.
Nice.
And 1 EMS on duty.
Okay.
So I might radio PD up in Plato and just tell them I can come up there.
And there's no way it's not me. But I just want to
Never
know
mind,
what
I can't
he thought
find
was a
anybody.
threat against his life, and if I'm even able to convince him that it wasn't.
Alright, let's have this talk, I guess.
Explicitly see fuck Percy Weaver, I'm going to kill him in one of my posts, then like what? I don't.
Alright, hi guys, how we doing?
Hey, Dax.
Hey, Martin.
Oh, man.
Hold on 1 second.
Yeah, I don't know.
You're
I
good.
don't see it, so I'm not sure.
Drama.
Yeah, I heard a touch of it.
Yeah.
Mm-hmm.
I heard a bucket of it.
Oh, I bet.
It's okay, everybody's getting threats from everything going on right now.
Yeah, honestly.
Are you guys getting threatened?
No, doctors get threatened all the time.
True.
Yeesh. Ugh. Well, that sucks.
Yeah.
I know how it feels, though.
Yeah, I bet you more than a lot of others, considering your mayoral term.
Yeah.
Alright. So, I'm gonna be honest with you here, Mr. Martin.
What's up?
I don't have the best of news to give you.
Okay.
So, you were brought in on the 2nd of June, so it's been a little bit over 2 days. When you came in, you had a couple minor bruises, scrapes, lacerations, a little bit of blunt force trauma to the torso. So when the scans were done to check to make sure you didn't have any internal bleeding or anything of that sort, our scans did catch something on the interior of your head, not necessarily directly in the brain.
333 will be 76
on the
Eclipse
right side.
2 EMT with 147 with multiple GSWs.
I took a secondary
3
scan today,
through-and-throughs, 2 lodged,
when
I
you started
believe.
kind of coming to consciousness a little bit. And it did reveal that those 2 abnormalities on the right side of the brain were
Sorry, I
tumors.
misspoke. 3 DSWs, 2 through-and-throughs.
And those tumors are potentially cancerous. We are not 100% certain at this time because we would have to do a biopsy to know for sure. However, with something of this magnitude, we always want to ask a patient what they would like to do. And I know this is a lot to take in, and I apologize for that. right now, based off of what we know, which again is just the presence of 2 tumors, we could go in and potentially remove them surgically. We could potentially try to go in and just do a biopsy if the tumors prove too large, and then potentially do medication treatments. But we would not want to do any of this while you were unconscious and without your consent.
Okay. Is it the kind of thing that needs to happen? Yeah,
Like, is it a right now, right this second kind of thing?
yeah, that's what I'm trying to ask. What's this like the?
The
I
decision
don't know.
will be made soon. You do not have to make it this second, though.
Yes. Both spots were relatively small. We do have a bit of leeway with time. I wouldn't suggest delaying this by 2 weeks to a month. However, you definitely have a couple days where you could think over your options and see what you might like to do.
23 Eclipse.
Okay. Yeah, I think this probably it's probably for the best.
Okay.
Yeah.
If you ever have any questions, please feel free to contact me or Dr. Grace, and we will do our best to get you whatever answers you want to know so you can make the best decision for you.
You said was it on the brain or just like a? Sorry, I was trying to catch up with that. What did you say? Or where were they? I guess.
From what I could tell on my scans, it looked as though there were 2 small tumors on the right side of the brain. So not within the brain, but growing from it.
Okay. Okay. If we need to schedule something, which one? I can I contact either, or I guess.
You can contact anybody you like, though I will likely be the one performing the procedure myself, or Dr. Pepper are the 2 neuro people.
Yep.
Okay. Okay.
Yeah, so either Dr. Grace or Dr. Pepper are our resident neurologists. If you specifically want to schedule anything, you can always contact either of them directly, or you can put it through an appointment request in the MDW. Either or.
Okay. I'll come to you, Amber, because I got your number already. It's probably the best way to do it.
Yeah, just contact me whenever you're ready.
I hate to interrupt. Is one of you available at the moment?
Yeah, I can step out if you want to finish going
I
over things, or...
can. This is more in your ballpark than mine. If you want to, keep on it, and I'll take care of the GSW.
Thank you. Sorry. There we go.
Hello. Let's see. Whoop.
I am not going to say anything because he's a judge, but I feel several emotions.
All right, I'm just gonna check over here, double check where all these GSWs are.
Then I'm not going to say, but just know that I feel them. I'm not going to do that.
All right, we've got a lot of blood loss.
I did blood fluids, TXA, and then I just did a chest seal and a seal on the back.
I'll be there soon.
Okay, perfect.
Mm-hmm.
It's looking like 2 of them might be through and throughs. The other one might still be embedded. I'm probably gonna have to take him into surgery and find out where that one is and get it out.
Mm-hmm.
Yep.
Alright, Cinder, quick, let's go before we get interrupted again. We need to get you food.
All right, let's go to surgery.
Again, we
Dr.
protest
Fera
this.
entering surgery.
I'm not gonna say what I'm gonna say.
Alrighty. We've got all our IV fluids and things going on. We've got our chest seal on the front and the back. Let's go ahead and take a quick ultrasound. We'll see where this bullet is. Alright, I'm seeing a little blip of it in the around the stomach area. Oh, nope, that is my mistake. It looks like it's lodged near the heart. Alright, let's get things cleaned up. We'll get an incision and get in here and get that thing out. Ember, Nora, you good?
I'm good. I'm right by, so I'm gonna try to get out of the area of it.
Alright, this isn't looking great. Let's get in here. I'll get a little bit of TXA and blood going. That should help with some clotting and then help bring that blood volume up. Let's see, did this nick the heart or is it just nestled near it? Alright, it's just near it, thankfully. Doesn't look like it perforated the heart itself. Alright, just a slight graze
Alright,
to this
everybody
exterior
here,
musculature.
sounds like an officer might have been run over outside.
Yep, I'm coming up to it now.
Alright. Let's see if I can't get this bullet out of here.
Then are you gonna be good by yourself here, or want me to stay with you? Alright. Lucky and I are gonna protect the front.
Alright, bullets out. Let's see if we can repair the area to this heart here. Yep, I'm having some issues getting this musculature to repair for me. Let me go in with some vascular sutures, see if that does anything better. Okay, good. That's working for me. Alright. Is there anything else wrong with this heart here that I can see before I start stitching up? Alright, heart's looking good. I'm gonna start closing this embedded area. Alright, other two wounds were 2 through and throughs, I believe. I don't know what medis treatment means. I guess medical treatment? Alright. Let's check and see how these through and throughs are doing. We'll rinse them out, see if we can't start getting them sutured up. Yeah, okay, these through and throughs are both non-vital. We'll get that cleaned up and stitched up. Alright, that's got that first through and through done.
I know.
Throw a couple of bandages on there and then we're good.
It's true.
Hello.
Can't deny that.
Alright, let's start with this second through and through. Alright, second through and through, all good. It looks like vital signs are improving for me, so perfect. I think he's gonna make it through surgery. Wonderful. Alright, second through and through is all done. Let's get some bandaging put on here. Alright, everything's looking good to go. So just for my records, are we going to intake this patient into the ICU? Or will they be feeling okay just once this anesthesia wears off? Alrighty. Yeah, the vitals are looking good enough. They'll probably wake up once this anesthesia wears off. I'm gonna go ahead and remove these IVs. And we'll take them into the observation ward just until they wake. Okay, Selena, I've got him. We're gonna run to the observation ward, and then I'll get all that stuff settled. I'll be right back out.
Okay.
Go for Selena.
I used my nub to stabilize the needle.
Oh, you're so smart.
I saw it. It was great.
Okay. My guy's still in observation right now. He should be waking up soon. I got you.
Alright, I'm gonna get him readjusted right quick. You might wanna just readjust his cuffs here in a second.
Yeah.
Oop, I'll get out of your way, sorry.
Yeah. Ah.
There we go. Surgery went well. Based on his current vitals, he should be okay to go once he wakes.
Okay. Just make sure.
Oh, I hurt so
Oh.
bad.
Oh, hello.
Good to
How
see
you
you're awake.
doing? I guess as much as someone can be.
How you
Well,
feeling?
all I remember is running and then gunshots.
Yeah. Yeah, gunshots did happen. A lot of gunshots. Feeling okay?
Probably. A little bit.
Just for my medical report, can I get your name quick, please, hon?
18981.
Alright, gotcha. Thank you so much. Alright, I'll get that medical report written up. Is there any spot hurting you where I could help you?
No, just a little sore.
Gotcha, okay. Alright then, I'll leave you to it.
Indy, can I get a...
Oh, you need a band-aid?
hang that. Yeah. I flew out of the car.
Oh, gotcha. Here, I got you a couple of ice packs here.
Okay. So, am I good for, to bring him to MRPD?
Yeah, he's medically clear.
Okay, awesome. Thank you.
Yeah, no worries.
Yeah. We are ready to roll out. You guys can
I only make my employees wear fursuits if they fuck up. That's the punishment. You wear the fursuit for a shift.
Okay, I'm gonna start up a medical report right quick, and then I should be good.
All good, Indy.
What's sequence? They freak me the fuck out.
I mean, I watched
Those
somebody bite
fursuits
another
are
patient's
scary.
ass. Like,
It's
just
definitely
been
not
wild.
naturally this color.
Okay.
That I believe.
What's up?
Hi.
Hello.
You know what? I am here as an emotional support human being for Liliana.
Gotcha. Okay.
Hi, Hannah.
Indy,
Oh,
can I get
hello?
your thing real quick?
Yes, hang on.
Alright, open up.
Ah.
What happened to you?
Just gonna swap. Swap. What's your state ID?
16257.
What bit you? I'll go bite it back.
Okay.
Perfect.
Gucci.
Why not?
Thank you.
Mhm.
Is it murky?
Nope.
Yeah, it looks
What?
like it's from the discount rag.
What bit you?
But it don't match it, so it look.
Yeah, I should be able
That's
to.
good.
We can go into one of the, medical side rooms.
Oh.
Actually, I like the psych office better. We'll go in there. Dr. Fera, entering into a patient appointment. Ember, if you need me for anything, just let me know.
I'm going to be going 42, but it looks like Jess is coming on duty, so I'll let her take over.
Oh, perfect. Praise God.
X-ray 3, I think, is going to be 76 to Eclipse with 247s.
Nora, don't do this to me.
I'm so sorry.
You're good, hun. What's their injuries?
Jess just clocked on. She's changing now.
You're okay, Liliana. Give me just 1 second to finish,
She said
finish
Jess
radio.
is going 42. She hadn't even gone 41
God,
yet.
please don't do this to me. Come on.
Hang on, I need to wrangle a doctor right quick. Y'all are free to go in. I'll be just a minute.
Multiple GSWs on 147, heavy bruising on the other. We'll definitely request fentanyl, just so you're aware.
She's changing.
Okay.
My boyfriend called and he needs an ice pack. I also need to just go home, so I'm just gonna clock
Yeah.
out when I get home.
That is very fair. Do your thing. Thank you so much for everything you've done for me today. I appreciate you.
Yeah. Also, whenever that meeting happens, just text me. I'll be around.
Okay. If he hasn't texted me back already, my assumption is that he just went to sleep, so...
Probably.
Yeah.
Dr.
Okay.
Payne, 1041.
Welcome aboard!
Welcome aboard! You won't believe
Yay.
this!
I have a dog, if that makes it better.
True, Cinder is around. Listen, I can talk to...
23 Eclipse.
I can talk to Holly and them, and we'll both just do a GSW patient. That way it'll go faster.
No, you're fine.
No, yeah, I'm gonna help you, Stinker.
Little baby boy.
Okay.
Yeah.
We have 2 criticals incoming, so I'm going to help take care of that, but as soon as that's done, I will be all yours.
Okay.
Also, good morning. I love you.
Oh. I'm fine. Yeah, I'm fine.
Yeah, you're fine.
Yeah.
Yeah. Hi, Cinder.
Yeah, but you have a hole inside of it.
Well, hello, Cinder. Cutie.
Oh god. Alright, he's got a hole in the side of his head.
Oh, joy.
Oh.
Yeah. And he just lost consciousness.
Oh,
Okay,
wonderful.
blood fluids, TXA, and I wrapped the head in gauze. That's about it.
Gotcha. Okay, let's take a look at where this head was wrapped in gauze. Okay. So that is a big old hole. Can I see brain through said hole, or is this just, or is this just some, through and through just to the skull? Or do we have some brain issues?
Help,
Okay.
I need fentanyl.
Protected.
Yeah, that
Gotcha.
too.
Yep, I'm seeing some metal plates in here. Perfect.
I abuse opioids, so nothing works except that.
Okay.
Alright, let's see if this metal plate was dented. If it's dented, I might need to grab a quick CT. If it's not dented, we're probably all good to just get stitched up.
No.
It is
I just
dented.
need a
Okay, we
little
need to
bit.
grab... Once
It's a teensy
they're
beensy
stable, I
bit.
need to grab a CT.
Looks like you had a vest on, which is good.
Okay.
Just making sure all of them hit the vest, none of them went through.
Alright, got a really good pulse. It looks like just the main injury is that denting of the metal plate here. Dr. Fera will be entering surgery. Replacement of metal plate. Alright, we're just gonna get this metal plate replaced, because otherwise, it would not be structurally sound, but it should be pretty quick. Here we go. We'll just put some IV TXA and some blood. Alright. Thankfully, we all have already have a pretty big hole for me to work with. So let's just clean that up a little bit, and then let's get this metal plate replaced. Yeah, Nancy, you're right. I would say that's about Texas-sized. Honestly, when I put the little skin graft on here... I mean, if it's Texas-sized, is it Texas-shaped? Because, I mean, if it's Texas-shaped and I put a little skin graft on here to help cover it back up, he would have a Texas scar on the side of his head here. Oh my god, it's like exactly the shape of Texas. Funny how things work that way. Well, this'll work. Alright, I've got this cleaned up. We're just gonna screw this old plate out, put a new one in, and then we'll do that little, skin graft.
But it's 20 out of 10. Not even a little bit of car fentanyl? Just a tiny, eensy beensy bit. Just a teeny weeny.
Alright, old plate is out. Just gonna check for any cracking of any of the bones surrounding where this plate was. Nope. Looks like the plate just basically distributed that force. No cracks or anything.
I think I'm good to go, Casey.
Alright. Let's get this taken care of.
Save them. We have more cops to shoot.
I will try to save him.
He better survive.
Don't save her. She don't wanna be saved. Don't save her. She don't
Say
wanna
that
be
about my
saved.
goddamn friend.
Talking about Project Pat. That's a good song. You know Project Pat?
It is good.
I love Project Pat so much.
Alrighty. Got this new plate on here.
I told you to jump off a bridge. Would you do it?
All that's left is to do the little skin repair. Hey, Jess.
Need assistance?
I'm just about to finish up. Vitals have been stable. His heart's as strong as an ox.
Alright.
The only lingering thing that'll probably come from this surgery, I mean, if you look at the, where the bullet went through and kind of ripped the skin, it's kind of shaped like Texas.
Oh.
Yeah. And it's kind of a big enough, you know, if it looks like Texas, it's Texas size, so I just need to put a little, pseudo skin graft here. He'll probably have a scar.
Scars the like the state of Texas, huh?
Yep.
Pretty cool. You know, I used to live in Texas.
Oh, yeah?
Yep.
Nice.
I don't wanna. No.
Yeah, it looks like a bullet just kind of pinged off a metal plate that was in his head. So it
Gotcha.
made him a little bit unconkers. He probably has a really, really minor concussion, but...
Yeah.
Alright. I'm still suturing up here. I thought I saw a flash of white down there.
Yeah. Well, note fell out.
Oh, what's it say?
Let me open it up and see. All my exes live in Texas. That reminds me of a song.
That's a banger song I was about to say.
Yeah.
Alright, I've got the head all bandaged up here. Vitals have stayed good throughout surgery. We'll probably just go ahead and run into the observation room. I doubt he'll need the ICU, but we can always consult with Dr. Nancy.
Yeah.
Ask her what she thinks.
Yeah, he's still in surgery.
Yeah, it doesn't look... With vitals as strong as this, I doubt he'll, have to be in the ICU. He'll probably just jolt awake once we get the IVs out.
Nancy, don't say that about the patients. I'm sure he's a pretty cool guy.
Alright. I'm all good. We can transport him to an observation bed and get everything, sorted out. Here we go.
Oh no, oh no. Is he dying?
Nope. All good.
Oh, thank God. That's one of my favorite ones.
Nice.
It's one of my favorite blocks. Is he going into the ICU?
No, we just need to, get his IVs out and wake from anesthesia, then should be all good.
Got you. Okay.
Yep. Alright, I am going to readjust him, and then you might have to readjust the cuffs on him here.
Yep, that's fine.
Yep. But otherwise, looking all good. Once he wakes, he should be medically clear for whatever y'all need to do.
Thank you.
Yeah, of course.
Puts cuffs on gently, soft, like a little angel. This guy's a little angel, and if he can lie there, great. If not, let me see.
I was faking it, dog. I'm awake.
Oh, gotcha.
Oh, you little rascal, you.
I was awake the last minute, dog. I thought
You
we were
little
going to Covenant.
rascal.
Yeah.
Well, hey, Texas.
What's good, dog?
It's good. Not much. I'm glad you're not dead.
Me too.
You're one of my favorites. I'll tell you that. You
Thanks,
and Rambo,
dog.
you guys are right up there.
Where?
Up there, my favorite criminals. If I had to deal with people.
I don't think so. People
You
really
guys,
think it.
you know what? Listen, sometimes
Alright, I will be in a
overwhelming,
meeting
but
for a
at the
little bit
end
with a
of the day, man,
patient. Let me know if anything crazy pops off. I'll come help, okay?
They might be.
Okay.
Okay.
Oh. Okay.
Alrighty, we can sit down if you feel like it, or we can stand, whatever you're more comfortable with.
Oh Jesus. Okay.
Alrighty.
Are you? I imagine that Phlox are probably about to go to jail. If it's a.
Okay.
Are you able to call Steph? Yeah, cause. Oh, thank you.
Gotcha. Okay.
Yeah, he's got a CDL and I don't, so. Yeah.
Do you know what initially caused your, inability to speak?
Just give him $50 and say, nah, dog.
And we can kind of figure out a treatment plan from there. Gotcha. Okay. Sorry, I'm just jotting down a couple notes. Yeah, I can totally work with you on this. That's perfectly fine with me. Okay. First step would probably be a CT of basically from your hips up. And we'll look for any physical abnormalities that might cause an inability to use like your vocal cords or something of that nature. Is this something you would like to do today, or is it something you would like to kind of think over? Yeah, that should be perfectly fine. Let's see. Let me look at my calendar. Okay, I should be available Friday, Saturday, Sunday from about 2 hours ago to 2 hours from now. So whatever of those days would be good for you would be good for me. And even if I'm not on duty, I'm always willing to come on for patient appointments. So don't worry about, like, if I'm working or not. Friday around 10 Central-ish. I should definitely be around. Let me set a little reminder for myself, because I am a goldfish and I will forget things. Yeah, of course. I should be in the City Hall app marked available, so you can text me from there. There you go. I got it.
I love that we can text you guys from that now.
And if for some reason I'm not around when your appointment time rolls around, just text me, because sometimes I'm a ding-dong and I forget. Yeah, of course.
Is that new?
Yeah, I can imagine. Gotcha. Okay. I'll definitely see what I can do for you. I'll start reading up on, potential procedures and things like that, but I'll know better after we do the scans kind of what our treatment plan might be. And if there's any questions or concerns you have, feel free to reach out and I'll do my best to answer. Gotcha. Alright, is there anything else you wanted me to talk over with you? Just to see if things are going good. Yes, ma'am. Sounds good. Shall see you Friday.
Thanks, Indy.
Yeah, anytime.
It's appreciated.
Of course. Alright, I think someone just called me that I need to call back.
Alright. You need to let us out.
Oh, yeah.
Hi.
Hello.
Hello. My name is Amelia, and I'm a lifer in prison.
Let me in.
Okay.
I was just calling to ask do you know if there's any EMS on duty? Someone is hurt here.
Gotcha. I'm not certain, but I can radio and see if one is available.
That would be great. I was going to try and 911 and see if someone answered me, but I haven't tried that yet.
Gotcha. I'll radio and see if an EMS is available. If there's not, I'll text you and let you know, okay?
Alright, sounds good. Thank you.
No worries. Bye-bye.
Bye.
Oh, okay, good.
There's a lot of really nice houses in Vinewood.
That is true.
Hey Nora, are you available?
Yeah, what's up?
I just got a call from a lifer that there's someone injured up at Bolingbrook. Or at the prison.
Yep, I can get that. Hold on.
You're all good.
Go in my mobile tackle.
Oh,
Oh,
I got them both.
God.
Kill me.
2 for 1.
Nice.
Well,
I felt
can't
compelled.
at the moment.
I know. Got your 611, so I didn't come by and visit.
It's okay. I know you were asleep.
Yeah.
I got bitten by a radioactive rabid lady.
I saw that
read
on the
report.
report.
Yeah, I read the report.
Who the heck bites people? Well, a
Sunflower Smith.
radioactive lady, but yeah.
Yeah. Yeah.
It was.
She's come in here before. You should remember.
Mm.
It's the lady that thinks she's a dog.
Yeah.
Oh yeah.
Or Jess, there's something in this that I don't think is supposed to be in there.
Yeah, I'm gonna.
That's fine.
I'm gonna
Only
put that in our
person with-
medical waste.
only
Behind
the
locked
person
doors.
with
What was
that
it? What was it? What was
ID
it?
can
A
use it.
SAMA credit card. It's not a huge thing, but if people could get to the armory, then they could use it to buy basically whatever they wanted of restricted stuff.
Yeah.
So
I figured that
No,
probably
only the
shouldn't be there.
person.
oh, that reminds me, I need to check this.
Oh.
Hello.
I also have this empty decontaminant tank for you.
Oh, gotcha.
And I didn't end up using all of these because I thought there was going to be a lot of PD at that scene. Turns out it was just me and Wade that took them.
Gotcha.
So
Okay.
there's some spares. Also, I did give my statement to PD about it, but they still have my stuff in evidence. I don't know
Gotcha.
if I need to speak to them to get that back or...
Yeah, I would put out a 311 and just be like, hey,
I just
this was
bought
the
that gun too.
this was the situation. Can I have my things back?
She took my clipboard too, with all
the
my
heck?
dinosaur drawings.
Rude.
Luckily, I label my stuff.
Actually, it's empty.
Nice.
Oh, yeah, I think an EMS emptied yesterday.
EMS?
With sanitation. I love this. Someone posted this, and I'm gonna keep it now because I keep having to. If I had $1 for every time I've had to do something regarding humane in this week alone, I'd have $3, and I hate it. Stop going there.
Do you know which EMS?
No.
I don't see an EMS on the government disposal list or the sales employee list.
Wait, who are you looking for?
To see the EMS who emptied it was part of sanitation.
Oh no, I mean like probably had sanitation here.
Oh.
And,
okay.
Yeah.
And they got
civ trash can be put in, or civilian trash
Yeah,
people
yeah,
can
yeah.
empty that. Yeah. They just can't empty that one. Typically, Q does it herself.
Well, I'm a government disposal person, so
Yeah, only we have access to the drug one.
Yeah,
And we don't.
doctors and stuff.
Yeah.
Okay, I have 4
Oh, I
reports to
better-
write and 2 to update. So.
Oh boy.
It's
I
been
don't think
a
mine's-
hectic start to my shift. I didn't even intend to be
Yeah,
here,
yeah.
but like for an hour. But
I was
that's how the
gonna
day
ask
goes.
if I can. I was gonna ask if I can be discharged or at least put down into observation. Because I wanna. I'm not gonna work, but I wanna go do the geocaches for today and just let my arm recharge.
Are you feeling like you have radiation sickness, Smile?
No.
I'm gonna leave you to this.
Okay.
I'll see you guys later.
You're good, Holly.
okay.
Do any of your wounds
Ember-
appear infected?
Oh, extremely. Ember did some of the cleaning and stuff. She flushed it all out. Gave me a lot of stuff. She didn't update
Gotcha.
the report though. She gave me some form of opioidal painkiller.
Okay,
I don't have a very high pain tolerance. Everything hurts.
gotcha.
But my arm felt like it was on fire. I wanted to cut it off.
Well, don't do that.
I know human bites are just the worst when it comes to infection.
Yeah, we're nasty. So
Dog
Ember
bites
gave
are
you
less likely to be
antibiotics and stuff
infected.
like that?
She did the whole shebang.
Gotcha, perfect. So, I'm okay with downgrading to observation. I'm a little bit concerned about the severity of the infection, considering the wound had to be cleaned out and stuff like that. But I don't see why you couldn't, you know, go do geocaches and things of that sort. Have you
That's all I wanna
taken
do.
any of the opiate?
She did it via IV.
Gotcha. Are you feeling dizzy, woozy, like you would be too impaired to drive at all?
Not really. I'm just very
Okay.
hungry.
Gotcha. Just keep an eye on, like, how you're responding to things and stuff of that nature, because I wouldn't want you to get pinged for driving under the influence, even if it is, you know, a prescription, right?
Yeah.
Okay. Then you should be good. I'll go ahead and get that notated that you're downgraded to observation. And I'm glad you're feeling better, genuinely. Worried me sick when I saw I had a 611 for you.
It hurts.
Yeah, I'm sure it does. I can't imagine.
It wasn't fun.
No, I sincerely doubt it was.
So the full thing, I was by myself. Oh no, Wade was on duty. There was a 47 call. I hear over radio. Oh, I don't like where that is. So I open up my GPS, and it's on the Chikansky Passage Road, just off to the right before it gets darker.
Doctors
Right
from
inside
EMS.
the exclusion zone.
Send it.
Do you guys have abilities to make medical reports for DOC?
We do, yes.
I might need you to make one.
Can do. Do you need one of us up there, or just a later notation?
I've got like a pretty severe concussion up here.
10-4. Either I or Dr. Payne can be en route shortly.
10-4.
Yeah, I can be en route.
Thank you. Alright, we're all good. Jess is gonna take it.
So I say over radio, everyone entering that 47, make sure you hazmat before entering, because it's in the exclusion zone. Then I also take them to Sandy. And then if you enter Sandy, you're not allowed to leave until my say so. I hazmat up. I take the Aleutian up there. Quarantine the area. Wade tells me, patient here foaming at the mouth, gash to the head. I get there, I treat them, I give them all the drugs, the 3 radiation ones and the potassium iodine. I treat them. They had early onset rabies, not full-blown rabies. And then they had some burning, like blister burning, not full-blown radiation sickness. So I just made sure that they were okay, they were not actively going to die on me. And then had to settle them into an ICU bed, made sure that gash was okay. We decontaminated the entire hospital, decontaminated Wade and I, decontaminated the ambulance, and then put the hazmat suits in a bag. I gave them to Wade, said, can you go down to the morgue, chuck everything into the incinerator? And then as I started the report, I saw that she started to stand up. So I went in, I said, you know, hey, I'm Dr. Hana Kageyama. I treated you. We're just checking you're all okay. She stared super blankly at me, and then she latched onto my shoulder, and then I blanked out. Next thing I knew, I woke up a few times, and she was gnawing at my arm. I reached for my
Holy.
radio, and then I passed out again.
That's crazy. And it was Sunny. Who?
No, Sunflower Smith. It wasn't Sunny Smith. Sunny Smith would not do that. She's smart enough to not go near Humane.
Gotcha.
Should I finish this report that I started?
If you feel up to it, I would go ahead just for the sake of record keeping.
Dark Pain 23, prison.
Right. Two 20348. It's her thing.
Gotcha. Okay. Okay, I think I am gonna sit on that bed by the ER and start writing up these reports here. Feel free to go do geocaches, whatever you want to do, just please be careful.
I'm gonna join you until I finish this report and then do it.
Sounds good.
Oh, can I get changed?
Oh yeah, of course. Here you go. Whenever you get done, just let me know and I'll lock the door back. Okay,
I'm done.
Okay. I need to figure out what the purpose of a chest tube is, because otherwise I'm just not gonna know. I could have sworn I just heard our... I could have sworn I just heard our garage door open.
I heard it too,
I'm
but
gonna
also
go check.
closed. I don't think it was locked.
Oh, then I'm definitely gonna lock it. I've not seen that crack before.
How's it hanging? I'm getting totally fed up with all the stupid tourists moving into my neighborhood, you know?
We're all good. Some local must have just walked by too close.
Should I include in the report that they weren't able to stay in ICU and that they had to go to like prison and everything?
If you were a witness to that, I would toss it in the notes, not necessarily the body of the report.
I mean, I wasn't exactly a witness. I was unconscious. I was the victim.
If it was something you found out after the fact, then I wouldn't worry about it. I would just notate down, in the body of the report, I would just notate down what procedures you did to Sunflower. And then anything else you think is relevant, I would toss in the notes. Okay. We'll clear that. When I did it, it was 6, 4, 5.
Oh, oh my goodness. What? What did they arrest her for?
Considering you might have permanent scarring, she could have gotten charged with mayhem minor.
She's in jail for 8,970 months.
Yeah. Hang on, let me look at charges.
I'm not seeing anything that's on her record that is even up to there. Like, she has mayhem minor,
Yeah.
but that's only 1,200 months.
No, mayhem minor is 4,300 months and then 1,200 months parole.
Dr. Payne 76, back to Eclipse.
I'm gonna be so real. If they're gonna just start beating each other up in the prison, I'm.
No, if they're gonna start doing stupid shit, the prison local doctor can take care of them.
Yeah,
exactly.
I think one of them's a jumpman.
Fuck the Jumpmans, and I'll say that to anybody.
Yeah.
Oh, that was on radio.
On God, for real,
are
for
they
real.
around?
Apparently one's in the prison. So they're not doing anything exteriorly, but they're, there's one in jail, apparently. There it is. Okay.
Dr. Payne 23, Eclipse.
Hmm.
Indy,
Mm-hmm.
when you have the chance, can you put on my medical record, just so it's not from me, about my extremely low tolerance to pain? I don't have
Yes.
any allergies to medication or anything. It's just that. And then when you can you also check your emails?
Yeah. Alright, note has been added to your profile. Emails. Jessica, could I ask you a favor? Unless you're, like, right in the middle of something.
1 sec. I'm just gonna do this report quick.
Yep.
To
I
be
know
quick,
you...
it was just a gash on the head and bruises.
Okay. After that, I know you like to drive the Illusion. If you feel like it, would you be willing to go run and grab us some food? And,
Yeah.
I'll pay for it.
Yeah, I was thinking about doing that anyway.
Nice. I know Limey's is open. I have literally no idea what else might be available.
Okay.
Actually, I take that back. Limey's is no longer open. What is my life? Well, I mean... I'm okay with pains if you're okay with pains. I'll still pay for it. Oh, Hana, I've got a quick question for you.
Mm-hmm.
Okay, and this is not a I'm mad question. This is a me trying to figure out what happened question.
Okay.
Yep. So when Sally was discharged, did she discharge herself from ICU? I know this is a good bit ago, so it's okay if you don't remember. I'm just checking
I
over.
remember because I can't stop thinking about it.
Mm-hmm.
It was a little bit of both.
Okay.
She was so adamant about wanting to leave, and I know we can't hold her.
Yeah.
I said to her, look, I think you should stay, at least for a little bit. And she said, no, I need to go. I've got to get out of here and do stuff. I made sure everything was okay, nothing was infected.
Mm-hmm.
And then I remember I said, just wait here for me, because I had another call, and then she was gone.
Gotcha.
And then 20 minutes later, she was gone.
Yeah. This isn't a big, huge thing. Sometimes we have patients that are like that.
She's always been like that.
Yeah, she has. I treated Sally several times.
Who?
Sally.
Oh, yeah.
Sally.
No, Sally.
Just as a
Sag.
note for the future, this isn't me being angry. This is just a side note. If a patient does leave AMA, just always make sure to notate that. Just in the notes, you can just put patient left AMA. Yeah. It's okay. Like I said, you didn't do anything against SOPs. You didn't do anything wrong. That's just more of a cover your own hide situation.
I didn't even get to write down when she left until a few days later because I just forgot.
Yeah. It happens.
I had Jay.
Can't go on a paint.
Okay. Can I get a 2
Jay
and 2,
called
please,
me.
ma'am?
Huh?
Yeah, Jay Garrison. A 2 and 2 for me, please, ma'am.
Okay. What would you like?
Alfredo garlic bread, 2 negronis.
Okay. Hannah, would you like something?
Yeah, can I get a 2 and 2 of vegan stuff, please?
Okay.
It's always... It hurts to lose a patient like that.
Dr. Payne
It
10-6
hurt
on a
more
food
because
run.
we knew her.
Mm-hmm. I will never forget the first time I lost a patient. It's something that'll stick with you for a long time. And that's okay.
Eleanor, do you have any food restrictions?
Strawberries, that's it.
Okay.
So I'm sorry that that's the way you lost your first one. It's rough.
If I just kept her here, she would still be here.
That's not something you can know for sure. This may sound ridiculous, but you never know. She had just had an amputated leg. She could have had a blood clot go into her brain and stroked out and died if she stayed. We cannot with 100% certainty ever say something was 100% at fault. There are times we can make pretty damn good guesses, but you cannot blame yourself for what happened, whatever happened in those 20 minutes. You don't know if it was somebody that was specifically looking for her and would have come into that hospital and shot her in the head here. You don't know, and you can't know. So, remember it and mourn it, but don't beat yourself up about it.
I'm gonna go do the geocaching.
Please stay safe.
You too.
Wait, Hana, do you want to wait for your food? I completely forgot that Jess was going to get food.
I completely forgot too. Glad one of us remembered.
Yeah, she's en route to the trucks, so it shouldn't be but another couple minutes. I heard a doggo. Oh my goodness. Hello.
I'm gonna be. I'm okay. I'm just gonna. I know that look.
I sense evil and malice.
Oh no. Oh no. Oh, now we're gonna act all cutesy and not do. That's messed up, Cinder. It's not like she's been gassing up the truck. Nope, never mind. There we go.
She. Dog farts.
Yeah.
Ugh. Cinder, honey.
All she had was some chicken from Bean Machine and some dry dog food. That's it.
Sure there wasn't beans in any of that? Jesus.
She still got a few more bags of it. I have to talk to the vets, be like, hey man, she's pretty gassy. This is like the first time she's had any gas that she's like this though.
Jeez.
Good God.
Like, normally I'm pretty okay with smells. I've dealt with, like, human shit, vomit, all that kind. That was nasty.
Yeah. Yeah, I know. Dear Lord.
Yep.
Okay. Don't act all innocent over there, young lady. Oh.
Bless it.
Oh. Dramatic. I should. I'll be right back. I'm gonna go get stuff from my truck.
Bless it. I'm gonna be honest, I'm scared to come sit back over there because I don't want to get crop dusted again. Rawr, rawr. Uh-huh.
Oh, what are we doing?
Oh, bless it. Bless its little soul. Wow, wow. Oh.
Why are we... Oh, why are we doing the big eyes?
Oh, don't look at me with those big ol' eyes. Oh, my soul. Oh. My horrid black heart. I want to pet Cinder so bad. But you're
can.
working.
Oh, Cinder rest.
Wow.
Is she on she's good to be on break. I saw that.
Alright, one
Man.
set of pets. Stinky. I knew it.
God.
I knew it. I think calling you "you little shit" is pretty accurate at this point.
Yeah. I think so too.
Just gonna have little pellets firing out of the back like a machine gun at this rate.
Oh.
You. I saw that.
Stinky. Stinky dog.
Where did you get bit?
My right shoulder and all along my right arm.
Oh. They gnawed on you?
Herman Smith.
Yeah.
Okay. That's... Okay.
Got basically eaten, but not the fun way.
Okay.
Happy Pride.
Yeah, happy pride indeed. Who's hungry?
It's me. Jess is grabbing us food, though.
What time is it? It may be time for me.
Nora, no. No.
It may not be almost 2 a.m. in my head.
Gotcha.
That's
And
rookie that's rookie numbers for you.
yeah, it's rookie numbers for me, but I have to be up at noon in my head, which is less than 10 hours out.
Yeah. Yeah, if you want good sleep.
It's not that I want good sleep, it's so that I can get up and roll out of bed and brew the strongest cup of coffee I possibly can.
Yeah, that's fair.
Because I need to be up to take notes for the people who cannot attend. Because I have done this to myself.
Oh.
Oh? What is it? Okay.
Bam.
Come on, Cinder, break over.
X-ray 303, going to 1012 for the 13 alpha. Running outside trying to find it.
Advise his blip shows he's moving slightly.
Woman here, orange pants, trying to punch me as I came out the door. Playing. Someone just got out of prison. Running northbound.
I think I found where the Jumpman is.
I need to check on Kate and I'm still on foot with her.
That's what that alpha noise just was.
Unit first arrives, go check on the individual in LSSD. Second unit, go back up Wilson.
I think that cop probably just got punched out.
Punch.
To 9 Wilson.
What's the alpha?
Alpha is
Woman, orange pants, last description.
orange pants. Reese.
Caden Whitman. Oh my god,
Never
she
heard
got
of
another
them.
one.
Last
Yeah,
call
got
out,
Whitman and
female
Veronica
orange
Wilson.
pants.
Oh.
And that they were attempting to punch her, right?
Yeah, when Wilson tried to exit the station, attempted to punch her, and then nothing after that.
So nobody else had
I'm
Sandy?
gonna miss seeing my
Negative.
picture on the ICE dashboard, just because it was always so funny.
Do you have anyone on Caden yet?
Believe so. We got.
If you're responding to Wilson, if you're the second person there, try and get to the clothing store right next to LSSD first.
There's 12. I'm a burger shot. I'm gonna clear it.
I'm clearing the clothing store. Next unit arrives, go to Caden.
414, copy.
Clothing store clear.
Wilson is conscious and talking.
Alright, one's conscious and talking. Nobody's checked on the initial. There's officers en route now, though.
Beer check. 10-2.
10-2 bug shot.
Okay. We have Wilson secured, unknown of what direction the female left.
Wonder One is with Caden, also claiming he got the shit beat out of him.
Wilson said the same thing. She got punched in the back of the head by the female.
Break, I got a burger shot. She was just in my car. Female, orange pants, running northbound, right, eastbound, birdhouse.
76 are coming.
Continuing northbound past the birdhouse on the eastern side, northbound.
Other
Your fence
units, stay
over
with the
towards the
officers.
skateboard. I'm Long Eyes currently, VCB. I think she ran to the left in front of the boathouse northbound. Baseball bat.
Yeah, if that ain't a Jumpman, I don't know what is. Just pulled out a baseball bat on me.
Oh, God,
Oh, they got her! They got her! Fuck yeah! W, W, W.
W.
W, 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 W.
The one in
Where are you currently
the prison is a female, so it might be her.
Alright, you're good to move in on the
Octavia.
13s. Let's collapse down to LSSD for triage.
Okay.
Tier 13 is at LSSD with Wilson.
So triage patients at the front of LSSD. 22E, motor pool, motor pool.
Motor unit, patrol the southern side of this building, make sure nobody comes up.
It's gonna be a Jumpman. There's probably more.
Yep, they called her out as a Jumpman. So it's definitely that one, more than
Alright,
likely.
I'm gonna collect evidence here at behind the boat out.
414's got evidence and pictures at LSSD.
Once we have initial processing of the suspect taken care of, if we can get them moved to the EMS that's at LSSD.
There goes my hero. Oh my god, thank you.
Welcome.
Tell me, that's your Ranger Cruiser, correct?
Vegan options.
Charge me for my foods. Stinker.
Yes, sorry,
I
was
will.
labeling it back.
Just
Stinker.
give me a minute.
Stinker.
Give me a minute.
Hehe.
can charge
Finally,
yourself.
water.
Yes, but I didn't cook it.
Alright, Ranger 4-1 done.
Doesn't matter.
I mean, how do you cook water?
Oh, I was talking about the pasta.
Alright, Casey's got a couple broken ribs, but apart from that, he seems to be okay.
Broken ribs?
I own the business, so I get all the profit. Anyway.
Guys, we have explosions at MRPD checking.
Fine.
I don't know why I'm looking at my GPS. I'm not on duty.
It's a weird habit. I do it too.
76 L,
Hmm.
8195.
Alrighty. Geocaching time. Please be safe. I know
You
that
too.
bloody Jumpmans.
Yeah, will do. Be safe. Don't do
Thank
any
you for
crazy
taking care of
jumps.
me. I'm a good driver.
I know.
Sometimes.
What the heck?
Oh no, I got you a 2 and 2 in the fridge when you get back.
Thank you.
See you, Jess. Thank you for food.
Of course. You pay for hers too, or do I gotta pay for it?
Sierra 13 got evidence from
I am now paying for it.
Alright, I'll get mine in Illinois.
Okay. There we go. Oh, I need to actually eat.
Yeah, my help.
It may.
Is there a report up yet?
Don't believe so. If you want to toss one out.
Yep, I got it.
All right, I have 2 of 4 reports done.
Okay. While they're still out, I'm gonna doom scroll Sunset real quick, and by the time I get back, they'll probably be on their way.
Probably. They said one seemed good, one might have potential broken ribs.
Alright, report's
so.
up. I'm gonna toss this evidence in. There wasn't anything around the 13's casings or anything like that, right? Negative.
No, just blood.
Favor.
Individual on motorcycle slow roll in the PD.
Alright, my evidence is tossed in. I need to help someone move a vehicle at the moment.
Okay, you're good.
So wait.
Alright, EMS is going to EMT with the 95.
Affirm.
Uh, 95 incoming from Cindy.
EMS, give us just a second. We should be good to roll out.
10-4.
All right, we're good. Let's go.
EMTs,
303, 76 Eclipse 140, 247 Doctor Stream EMS.
Send it.
147 with a single GSW through and through to the shoulder, and then another 47 with some heavy bruising on the chest and potentially broken ribs.
10-4. We'll take them both in the ER when you get here. Will you want assistance bringing them up?
One of them can walk right now.
Gotcha, gotcha.
Whiskey 1310 8. Someone left the door to MRPD unlocked. Make sure that we're double checking these logs.
Hey, Ferb. I think a bunch of people just flooded out of the building for that 13 Alpha.
I'm going up ahead to clear the hospital.
Well, highway 210 I can help you with that as well.
07 10 8. Am I needed anywhere?
Nah, yeah, you know what? You are. You're needed on patrol. You get out there, champ.
10 4.
Okay, so that's good. All that's left is literally a cowboy blocks.
Dispatch, Lima Attitude 1041, 1070, elevation Pinkerton Sandy.
Okay, twin star.
Yep. 2 incoming 47s,
Hey,
1
Verb,
potential broken ribs, 1 GSW to shoulder.
Okay. I'll let you take the broken ribs.
Okay.
Oh, you like bones.
I do like bones, but I've written 4 reports and notated 2.
Nice roll.
Freaking sweet, right?
Wicked.
Hell yeah.
It's freaking cool.
Nice.
Got a 95 coming in. Gunshot wound to shoulder. Female didn't tell you.
Okay.
Nice.
Broken ribs?
We can only hope.
Yeah.
Oh, also Casey's coming in here. He got hit with a bat in the chest.
Okay.
So that one might be broken ribs.
All right.
Hey, Cinder.
That's why I took the keys. So I could get in.
Hello.
And
Careful,
then
she'll
that
fart on you.
bald-head
Have
cop was
words with
chasing
you
me,
in a moment.
and so I jumped her as well.
So, okay.
Okay.
And there's Casey coming in behind you.
She
Hello.
threatened to attack the canine.
Alrighty. We're gonna do something a bit special for Mr. Casey. Let's go ahead and get him to, we're gonna grab a scan over here right quick. Considering it might be wokey. X-ray time.
I did it right. Oh my god, I did it right.
Yeah, good job.
I'm a professional.
Alright, I'm just gonna move this over your chest here since you had some blunt force trauma to the area, and we're gonna see if there's any brokey ribs.
Back in a second, Casey.
How could the CIS do this?
Alright, Casey's in the X-ray machine.
Veronica, do you know if Do you remember if she beat you down with a baseball bat or she punched you down?
She punched me now.
A firm. Thank you.
Alright, I've got my photo here. Let's see if you've gotten any broken bones or anything like that. If there's any internal bruising, it would also show up as some really dark shadows in there. Alrighty, I got my results here. I have good news.
Good news.
Oh.
So I was looking through here, it looks like you do have some bruising, and you do have some ribs that are hairline fractured, but it's nothing that should need any
Oh.
kind of surgical intervention.
Oh.
Yep.
Oh,
So,
that hurt.
oh yeah, I bet. So I'm just gonna take you to the ER. We're gonna get you a little bit of non-opiate pain meds on board and wrap up your chest really good. But then
The
after that, you
CIS
should be
did
good.
this.
We can
Alright,
blame the
Casey.
separatists.
Stupid seppies.
Wiccan separatists. Have you been playing Battlefront 2 lately?
Fucking love it. I love that game.
Definitely not at all, no.
No, of course not. That's what I've been playing on my PC. My house.
Casey's saying the clankers broke his
The CIS did this. The CIS did this.
You're smothering me with ice packs. It was that
Here we
fucking
go, let's
cop
get you
that
wrapped
shot
up.
me.
Alright, we'll get you repositioned.
Screw you, Count Dooku put you up to this.
Pussy.
Alright, Casey, do you have any medical allergies that you know of, hun?
I'm allergic to caterpillar and papaya fruit.
Gotcha.
She is good to go.
Alrighty, so I'm gonna give you a good dose of Ketorolac. That should help with your pain. And then we're gonna wrap up your torso so you can't move too far forward, back, left, or right. You're gonna have really good posture for a little bit. But that should keep your ribs from moving too much.
Oh.
I'm gonna fucking jump you if you keep talking.
Yay, good posture.
I don't even know what the fuck you just said.
There we go.
I hope you know I heard that I'm gonna fucking jump you. I'm gonna fucking
Yeah, that's the one I traded in the prison.
Oh.
Wow.
I nearly took that bitch in
Yep,
there.
who knew?
Who could have known?
That fucking blonde-haired girl. I hit
God,
her
you're
pretty
fucking
good.
ugly.
Actually kind of look like Ventress.
Jesus Christ, yeah.
Fuck
Jesus.
you. I look beautiful. I look better than you.
How's he looking, Doc? Is he gonna...
She worked for Count Dooku, she confessed.
What the hell? A Sith Lord? They were all dead.
She works for the Sith Lord, the rule of two.
Oh my god.
Be the two. Be the
How's he
one.
looking, Doc? Is he going observation? You gonna be able to come out?
That
You need
should
to
be up
mobilize
to
the 5
him.
first.
I'm okay to release him if that's what he wants to do. I've got his torso wrapped up pretty tight, though.
Alright, Casey, you walking out of here? You staying in observation? What you doing, little guy?
I'll walk out of here.
Alright, cool. Tarantino,
Just
get
walking out.
Bean in the 95 to MRPD. I'll drive Casey over.
Okay.
Yeah.
Oh.
Come on, Casey.
Oh.
Like you're supposed to.
Lena, stay with Levi.
Hey, the 95 is good to go, yeah?
Alright.
Oh, hello.
I ain't a number. I have a name. It's OJ. What the hell?
Oh.
How do you know my name?
that,
Well.
since she threatened to jump the dog, I have sent the dog off duty, and I'm gonna go lie down.
Yeah, that's fair.
Yeah.
Because
Did you get your food?
Yes, I did. Thank you so much.
Okay.
I needed it actually.
Yeah, no problem.
Okay. Stay safe out here. I guess the
You
Jumpmans
too.
might be around.
Yeah.
Usually if
there's
they're
more.
around, they're on Twinsta. And I've not seen one.
Well, I think that was the lady from the prison earlier.
Yeah, it was. Oh, this
So that
same
might
one.
be why. Hold on, I gotta warn Micah.
Yeah. It is rare to see them without, like, there being 4 of them.
Yeah.
Or more. So
That's what I'm used to.
Yeah, we'll keep our head on a swivel.
Okay, stay safe.
You too, Nora.
Take care. Bye bye.
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 Swear to God, stupid Jumpmans. I wish they would all just die. But I'm a doctor and can't say that. Smile. Whatever.
Yeah, I know. She said she might jump me later, but she
Cool.
appreciates me right now, so
Alright, where are we processing at?
I was like, okay, well, I'll be ready.
Yep.
Alright, lead the way.
Alright, I've got one last report to write.
Okay.
Cowboy Block. Actually, is Holly still around? Yes, she is. She's had nicotine for a while now, so I'm gonna roll this with disadvantage, but I don't want to roll it where Jess can see. So I'm gonna roll it over on my second monitor.
That is one ugly woman, by the way.
Yeah, I saw her. I'm hoping that was makeup and not rosacea. Because, bless her soul, I get bad rosacea sometimes, and... Wow.
She also had a kind of a beard, like the starting of a beard, so.
Oh.
Yep.
Radio check.
10-2.
Dispatch Whiskey 7, 1041.
Morning.
There we go. Got all my plates in.
Nice.
My stomach is all full.
Heck yeah.
Thanks to Payne Family Pasta. What a great place.
I know, right? Oh, that's a nat 1 on disadvantage. The social anxiety didn't break through. That's rough. If it had been more than 5, I was gonna, like, bring her back to the cat's paw, but have her, like, smoking twice as many. Beep, 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 beep. I didn't realize that, Cowboy Block's name was Texas Young.
Yep.
You learn new things every day.
Yeah, just like Rambo's is Leonard Washington.
Yep, I learned that the other day too. Were you here when the blocks came through, or was it in... Or... No, you were here. You had just clocked on duty.
Yeah, I was here.
Did the EMS bring them through, or was it PD?
It was EMS.
Okay. I might curse myself by saying this, but I might have like 30 minutes left in me before I will want to go and do something else.
Yeah, I think I'm going to bed. I'm going to bed soon.
Yeah.
Boulevard, motorcycle one time's occupied.
Oh wait, 276. 414 attached.
Because...
Ah, what a perfect post from John Harper 2 hours ago.
Oh, do tell.
If only there was an app that shows who's on duty. Not me, though.
Wow.
Wow.
Mm. You know, they're taking applications for car dealerships.
Mm-hmm.
I have thought about putting one together for an adventuring / off-roading one. So, like, dirt bikes, potentially four-wheelers in the future.
Yeah.
Mesas, pickups. And stationing it up in either Sandy or Grapeseed.
That would be cool.
I thought about it. I don't know that I'll actually do it. Because I don't think that would be something
Also, guys,
I would
four cops for this.
continue. I would continue. I would continue to have
Wait, is that what he
passion
said?
for
No, that's what I'm saying. I'm
for
saying
a
four
long
cops for
time.
this.
Wait, just a fucking hands. You really got a problem with it, man? Like, come on.
No, never mind.
He is saying you've got too many units allocated to that traffic stop. You only needed the primary unit in garrison. Anyone else break off. Less nice about it. Whiskey 13 pursuing a Rainbow Livered Segoy northbound Strawberry 38. Unknown occupant.
236.
Oof, we gotta get with the rest of the program. Indy.
Oh, what have I missed? Hello.
This damn kid! God! Put me down!
38 Westbound Vespucci, code 41, warning issued 01510.
Hey Andy, how's it going?
It's going good. How are you doing? Oh, I see. Hi, you
Hello.
two.
Hey, go the wibboey.
How you doing?
Thank you so much. I'm doing okay. When
Holly charged you already?
no, I need to still pay for them.
Good night.
Wait, Selena, call me real quick.
State ID?
16257. When Holly said Sabina is on her way, I was like, who is that? Now I understand.
Oh my goodness.
Hello.
I'm just grandpa.
I see.
That's true.
I'm grandpa of the club, so might as well.
That's fair. You make a very dapper grandpa.
Thank you.
Sierra 71042. Good night.
Damn, Sabina. Good job.
Thanks, Holly did it. I don't know how to dress myself as a woman.
Yeah, I couldn't help in that department either.
Whiskey 13, one warning issued.
That's fair.
I wore boy clothes and skinny jeans when I was a woman.
This
Nice.
is true, actually.
Yeah.
You just actually think about it. You did just very much already.
Yep. Because I didn't know it yet, but I knew somewhere.
True.
Somewhere deep in your jellies.
Yeah.
I love that. Also, yeah, we're not dressed like this for any particular reason. No.
No, not at all.
Oh no.
Just for funsies.
Just for funsies. Definitely don't look at our MDW.
Oh.
So they're on the clock.
We're not mandated reporters, Smile.
Yep.
Oh, okay.
Oh, I see. What the heck did you do?
I don't know who those people are, but they seem pretty dangerous.
Oh, no.
Yeah. Crazy.
Mm.
A month later is wild, is all I'm saying.
What?
A month?
Oh,
a month later is wild, is all I'm saying.
Yeah, it took them 30 days to push that.
Oh, I see.
Yep.
That's
Gets on the
wild.
radio to PD. I'm just kidding. I'm
Oh
kidding.
my God.
I'm kidding. I'm kidding.
Which, you know, a certain someone shouldn't have that. But they do anyways, so whatever. It's interesting times for us right now.
Oh.
I don't make the law.
Yeah, I know, but the only thing tying you to that is fucking stupid.
We'll find out more tomorrow, hopefully.
Yep. Yeah, Bree went and turned herself in to get it FOIA'd.
Oh, okay.
Yeah.
Which that
should
parole,
be out in the
though,
morning.
my God.
Yeah, the parole is rough.
That's insane.
Yeesh.
That's until Sunday morning.
Yeesh.
Oh my god.
What the heck did they have y'all pinged for?
Well, you look at the list of charges and see what the worst one is on there.
Yeah, for Bree.
Ew.
Right, eastbound, Eastbourne Way.
Ew, that's rough.
Right, southbound,
Mhm.
All I'm saying is, you know, some people say the quiet part out loud, and some people do the quiet part out loud.
Yeah.
Right, southbound, Las Lagunas.
Oh, a month late. Oh, okay.
Yep.
Gotcha.
Mhm.
Yeah, that's a long ass time. What the fuck?
It's because they only had 15 more days to be able to do it.
Yep.
Oh, I see.
I'm
Can I just
curious
say,
as to who.
apparently, okay, we were told by some people it's a lengthy reward. Okay. Why are the cops like just now starting to do their fucking jobs on something that's like less severe than, you know, the person?
Alleyway off of Steel
That's all I'm
Towing.
saying.
Right, westbound alleyway back to Power, left southbound
Especially
Power.
when a
Why would they
lot
do
of
that for
people
witchcraft?
wanted it
What
to
the hell?
happen.
Yeah.
Right, westbound.
I'm a 2 times convicted witch.
True.
Just one. But his first try. You fucked up.
Red Garage,
Fuck
westbound
you.
Vespucci.
It's so hard to get the first one, but after you get the first one, it's actually not that bad.
Yep.
Westbound San Andreas.
Yeah.
That's the only one
They
who
just laugh
pleaded
at me.
guilty.
Okay, I didn't accidentally do this, but Micah and this is when Holly was doing her expungement. Micah and Holly were like 2 hours into a shift with nothing, and they're like, "Come curse us, we need something to do." And then right after I cursed them, the block shot a bunch of cops.
Oh my god.
Oh yeah, you know that. You know about that. You called me after.
Southbound and
I was in the ER locked behind doors while they were shooting people.
I'm sorry.
Or I was
Listen,
in the OR block.
Listen, like I said, you can blame Holly and Micah for that. I may have
Yeah.
done the deed, but like.
Yeah, they
listen.
self-snitched like while we were locked together back there because Eclipse was on lockdown. And they were like, "This is our fault," but also go stare at Bree and Seb angrily.
I may have helped set the curse, but the curse can take many forms. Sometimes it's very bad. Sometimes it's you know, you stub your toe. I can't control that.
Yeah, true.
True.
Curse
Very
is a
true.
curse, and whatever form it takes. Well, some days you roll the dice and it's good, and some days it's oh my god.
Yeah.
So.
Honestly, I would assume any curse on the hospital is just gonna magnify tenfold because this place is haunted as fuck, dude.
Yeah, I've noticed.
Oh yeah.
It's so haunted.
I've really noticed. It's kind of wild.
We had a ghost send a ping to a golf gang member.
No.
From a dead person's phone.
From the morgue
From the morgue.
downstairs.
Yeah.
Whoa.
Mm-hmm.
Yeah.
But y'all
then
have a
the
morgue
phone-
downstairs too?
Yeah.
Oh
Yeah.
shit, okay.
It's a hospital.
Yeah, but usually the morgue's a different spot.
Well, they have a morgue for like, you know, doing stuff. Before sending it to like the official morgue for burials.
Yeah. We have the morgue downstairs, and then there's the mausoleums where everybody ends up going.
How does this hospital is apparently so big yet seems so small?
Multiple
We're
floors.
only allowed to be in certain areas.
That's fair.
Yeah.
Yeah, we have a whole motor pool and a bunch of rooms downstairs.
Yeah, the underground garage is where the morgue is.
Also, it doesn't help that there's, like, this entire room isn't open. There's, like, 2 giant pillars in the middle. It really restricts the space.
Yeah.
I guess anytime I go under, you know, in the motor pool, I'm usually unconscious, so I don't really see much.
Yeah.
I don't know if I've been in the motor pool.
You're not missing much.
I know I have. I just don't know what it looks like.
I don't think I've ever needed to get medical after being arrested. That wasn't done on scene, at least.
I have plenty of times, but it's because usually, like the last time I got caught for this. I don't care. I got into a chase and I wasn't the driver, but somebody hit something and I flew out and Seb was all over the pavement.
I checked and I said that's it.
Yeah, that was not fun.
Mm-hmm.
May have been a pole involved. I don't
Dispatch
remember.
channel 2 collapse GTL.
Then I woke up in there.
Sprunk
Listen.
delivery, beer 400.
I didn't say anything, Grandpa.
Listen. I did my best.
Oh, I see.
I was gonna pick you up. I was gonna pick you up, but you were on Conquest and there was 4 cars.
Oh yeah, I'm pretty sure one of the cops ran me over too. Apparently.
They did.
Yeah. That was fun.
Yeah, it was one of those. You seemed like you were fine, and then you weren't.
It was fine until I wasn't.
If you two lovely people would like a tour, we can probably give me a tour.
Ooh,
Yeah, honestly.
A tour?
Just Sabina and Grandpa, you know.
Yeah. So long as
Come on.
patients don't come through, you know.
Heck yeah. Grandpa might need that more than me.
Come here, Grandpa.
Oh no, you're both gonna.
Are we going motor pool or roof first?
Motor pool first.
Heck yeah.
I like it.
Okay.
Cute.
I don't know how I feel about it yet.
This is our morgue.
You know, checks out. Okay.
God, if I
Yeah.
keep making myself walk like this, I'm gonna end up walking like this. My back.
Oh, that says caution over there.
Yeah.
I'm gonna stay over here.
Over here.
This is the one that spooked us and called people to come help.
Oh. Still not buried. Okay.
Yeah.
Oh. Yeah.
That's the incinerator.
Weed from that twin supposed has been
Oh.
collected, 76 MRPD.
Oh, see, that would have been great. Just
Yeah,
open the hatch, chuck her in there.
Yeah, exactly, right?
That would have been fucking awesome, actually.
Uh-huh.
Everything we literally asked for, but you know.
Well, actually, you know, how I do all
Yeah, then we sweep her out with all the rest of the ashes and just
Yeah.
throw her away.
Yup.
And then our motor pool.
Oh shit, this is actually pretty big.
Yeah, it is. That's nice.
Our EMS vehicles, and then the doctor car over there, and we've got a few other doctor cars in the valet.
Yeah. Y'all have seen the illusions.
Yeah.
Yeah.
Yum.
Yep.
Okay. Heck yeah.
And now,
Hey, we got that BF 400.
Oh my god, I've been yawning.
Oh, crap, I got back.
Nothing to see here, sir.
It's code 4.
EMS from PD.
go the roof.
No EMS on duty. Self-transport.
Into woof.
Can do.
Oh my god, hell of a
Oh.
chopper.
What's
Wasn't there like
shit.
weird cult shit happening over here the other day or some shit on the roof?
Probably.
I was hearing
Maybe.
something like Mercy, some people were doing something called the High
Oh.
Society or some shit.
Yeah. They committed a little bit of terrorism
on the 60s?
Yeah.
and treason.
Oh my
We're chatting with him now, but he is on his bike.
Alright, well,
Oh,
Okay.
guys, it's Creeper.
Yeah, please don't fall off the roof.
Yeah, I don't want to be a doctor, okay.
Yeah. She fell from that crane right
Yep,
across from us. Yeah.
that's what
I've
she
done
told
that
me.
before.
She said, I fell from a crane. Let me guess. It was that one. She's like, yup. Like, I have, unfortunately, had that happen too
If
many
you
times.
come over here,
insert
yes.
number here.
Jess, I think we have a PD officer en route. I'll take care of it.
Motor 176 as well.
Nice.
Actually, no, we don't. They're still a long ways away.
yeah.
Okay.
That's what I figured.
Yo, this is kind of awesome.
Yeah.
Mhm.
Yeah.
It's nice and quiet too.
This is
Simple
where
but
we
quaint.
write reports and cry.
Continuing north.
Yeah.
You can spy on the parking
Yeah.
A
lot.
lot of crying.
Lots of crying.
Oh, you can.
I like looking that way because the observatory.
Left westbound Vespucci.
True.
Oh, that is
Right,
nice at night.
northbound
Ooh.
passing Steel Town, currently VC.
And then you can actually get up on top of the AC units.
I have a piece of that fence on my ring.
Nice.
Yeah, it's where me and Rowan went on our first date and then started dating. So I
Aw.
took a piece of the fence and made matching rings for us. And then I
That's cute.
proposed there a couple years later.
Nice. Do we still have chickens or are they gone? I think they're gone.
Southbound Lower Laporta.
I'm coming. Grandpa's coming.
Listening at southbound Lower Laporta. Approaching the Innocence turnoff, taking the Innocence turnoff. Continue left eastbound Innocence. VCP currently, I believe we went right southbound.
Yeah.
He's just behind the gas station.
Oh, Z copy.
It's very nice.
Yep.
Coming out.
This is my favorite
right
report
southbound,
writing spot.
left northbound even.
I can see why.
It's nice.
Yep.
Especially with the sound of the fans too as the background noise.
Yeah.
Adams Apple Boulevard. Can we,
Very
let's
good
go
stimulation for the brain. I love it.
This VR.
Are any EMS actually like helicopter trained or no?
Yeah.
Clark.
That does not surprise me.
I think Sargon is too.
Oh, okay.
There's not many.
Yeah. Yeah.
Yep. It's funny because Clark's call sign when he goes in the helicopter is flight risk.
Checks out.
Yep.
Love that.
Alright. I think PD's on their way.
Oh, okay.
Okay, let's go.
Y'all should be able to use the elevators yourselves to get down to the
Sweet.
main floor. So we don't have to tote Grandpa. Jesus Christ.
Dude,
Basket
it was so
ourselves through.
fun.
It was really fun.
It was human basketball.
You guys should be able
Yeah,
to
it's
go down to the ground floor.
Okay.
Do y'all want to stay up here until PD's clear, or...?
I mean, this should...
I realized I T-Hew'd too close to the sun and I was already, like, jumping in the elevator.
Yeah, I was just
Oh, we're
telling
good.
Jess that ladder that we just went up.
Mm-hmm.
We used to have one of those at our clubhouse before they got taken off. We used to do human bowling by sending from one side of the roof into the basket.
Nice. Hello.
Got another one.
Hey,
What happened?
jumped off a roof into a pool.
Oh, gotcha.
Yeah.
Alright, since you did go into a pool, I'm gonna check your lungs for any water real quick, okay? Alright, your lungs are sounding clear. Did you hit anything on your way down? Kind of give me a
My
little
back.
rundown. Your back?
My back.
Okay.
So I
thought you belly
jumped.
flopped.
Tell you later.
It was kind of like back, and then on the side, and then I belly flopped into the water.
Gotcha. Okay. I'm just gonna roll you up just a bit so I can take a look at your back, okay?
You're welcome. I'm bruising it. Yep.
Alright, I'm not seeing signs of anything too serious. It does look like you bruised yourself
have
up
that.
pretty bad here, though. Yeah, I'm gonna put a little bit of lidocaine cream on it, so that should help kind of numb it up a little bit.
No. Unless you deserved it.
Dispatch channel 2, collapse, UTL, same beer 400, last seen.
Alright, I'm gonna put a couple wraps around here.
Oh.
Alright, I'm gonna try and help you roll to your feet. If you start feeling dizzy or anything, feel free to sit right back down, okay?
Okay. You're fine.
Nice.
Hey.
Anything
love a
still
roof.
achy, or are you feeling all good?
Well, my back hurts, but I think it's just the bruising.
Yeah.
Yeah.
Alrighty.
Doc. I appreciate it.
Yeah, no worries.
Because.
Oh, I now understand the tackling.
Uh-huh.
Mm-hmm.
I didn't want to take it.
Silver comes up, tackles me, and goes, "Who's that old man and that lady?"
Freaking pick it up.
Like, I'll tell you later, Silver. I'll tell you later.
Nice.
Yeah, now you're gonna go.
My reports are all done.
Hell yeah.
From the beginning of my shift till now is how long it took to finish all my fucking reports.
But it's
Christ's sake.
medically.
Yeah,
needed.
it do be like that sometimes.
Sometimes it do be like that. I intended to be around for like 1 hour just to check up on Ash after her surgery.
Yeah.
And then I got called into a million different things.
Yep.
And I figured it
Like
out.
always.
Yep.
No, I gave you the location. I knew.
And I bet you your guys' job is a little bit harder now that Mercy and Q are on strike.
Dog shit has not changed one bit. It does not matter. As a matter of fact, I'm getting more response from them now.
Oh.
Yeah.
Amazing.
It's wild. I literally
Alright.
got
Say I'm
called
right.
or texted by Anthony Pendragon.
Say I'm right, Tommy.
Because, oh, some Dr. T for you. So did you
Sip.
see the text from John Harper in the Sama chat? That was like, and if you need Q herself to tell you, search DNA in the chat.
Patrol, MRPD,
Yeah.
meeting 5 minutes
Okay.
back, meeting room.
That was due to Anthony Pendragon.
CA 1376.
Hana attempted to get
No.
Anthony's DNA because they're typically on shift together because they're both really late shift 3ers.
I'm catching strays.
And Anthony basically told her,
Oh, buzzer.
no, I'm not doing that, and if they want me to do that, Q herself would have to tell me.
No, come to this one.
After Q was the one that texted that in the Sama chat.
Yeah.
So Hana told, she elevated it to a shift lead, she elevated it to Kelly because Kelly was around. And Kelly went and talked to him, and he basically reiterated the same thing to her. Q herself is going to have to tell me to do this before I'll do it. Yep. And then
I see
shortly,
you finally did it.
Yeah. Ember got me when we had a spare moment earlier on shift today.
Damn, I was gonna do it.
Yeah, I need to grab one of those to toss in my belt so I can catch folks if they've not done it yet.
Yeah. Why is Silver Kick in the bed?
I don't know.
Okay, bye.
But
Okay.
anyway, Anthony requested to meet with me yesterday, but I was not around yesterday. Santi and I were watching movies at our house, and I refused to wake up just to deal with that. Because I knew what he wanted to talk about. And basically, Q had said in our leadership chat, I want a chief to talk with him. And I'm not gonna go against Dr. Q.
Nope.
So, when I woke up today and came on shift, I texted in there and said, Anthony requested to meet with me. Do you want me to just kind of ghost him until a chief can talk with him? Or, like, what do you want to do? And Q said, I'm around. I'll talk with him. Just let me know what time your meeting's scheduled to be. And I said, yes, ma'am. And then Anthony never texted me back, so the meeting didn't happen.
Oh.
Oh my gosh,
And I told him I would be available from the time I clocked on duty until 10 minutes from now. So.
Alright.
And if he comes around later than that, I'm not available because I am going to sleep.
Okay, so Silver.
Mm-hmm.
Old man and lady. Who do you think it was?
I don't know. They look familiar, but I don't remember.
Indy, do you want to tell her?
Oh, it's some
Or
of the
do we not?
people you quote unquote don't like.
Oh,
It's 2 of the death omens.
I knew it. Why are they for stuff like
Active warrants.
that? Should I snitch on them?
No,
No?
because the one you really don't like already turned herself in for it.
Well, they're a group, right? So it doesn't matter.
Silver.
Look, I'm actually really in good with this
Let's
group,
see.
and they've promised to kill people for me, so, please don't get on their bad side.
Ooh, you're gonna not like what's going on then. You're not
Don't,
gonna like what's going
don't do it.
For real, for real. I don't know if I can
Don't
tell
do
you,
it.
but you're not gonna like what's going on. For real, for real. Oh god.
Oh, don't tell me that the freaking... We're not going up against them, are we?
Ooh.
Oh, this is a
Maybe.
y'all conversation.
I'm not even part of...
What the?
She's not part of the group. She don't want to hear about it.
Yeah. Soon she'll come back. She'll come back, I swear. I miss her already. She's not even that far.
We could just take the talk to her. But the fortune isn't going up against you, am I? Silver.
Ooh.
Please tell me no.
Ooh.
I mean,
Well,
they don't...
there's some shit.
They don't know I'm associated,
well,
but...
part of it's, they kind of deserve it, to be honest.
What did they do?
It's honestly real stupid, but they kind of deserve it.
Okay. What did they do?
The Ballas,
Mm-hmm.
they went up to them to talk to them about a flag that they wear. Because, like, that's outside flag or some shit like that. And they were like, he went up to them, like, you know, like, straight up, not even, like, disrespectful. They just went up to them. Yo, like, I don't know if you guys should be wearing that, because, you know.
Wearing what?
The flag they wear.
They don't
Or they're
wear
hanging
a
around.
flag.
Yeah, they wear a flag. That's the point. That's what they were beefing about. And then they were like, yeah, maybe you should wear that. Like, that's like part of the Southside culture that you guys are an MC. And then they were like, nope. I don't care what you say. We're still gonna wear it. Haha. Technically, this is. And then they were like, what? Like, why? Like, being stuck up like that. So now they're pissed at each other. Well, no, the balls are pissed at them. They're disrespecting them, low-key.
Okay. I don't know a lot about Southside culture. What do you mean by a flag?
The flags they wear on their face to cover up, like the purple ones, they wear like the ones with the skull, right?
Yeah.
Yes, and their hang-arounds or whatever the hell, like the lower ranked ones, don't have a cut. They wear like a lighter color, more southside looking one, like with like the white on it, kind of. It has a pattern.
Oh, like the handkerchief type thing? Or not
Yeah,
the
like
handkerchief, like a bandana type thing.
Yes. Like they tie around the face. And they were talking about just that one. They were like, yeah, maybe you should wear that one. That's more Southside. Like, we wear that association. The other one's fine, like, whatever. So we don't wear that. And they were like, no. They're like, we don't like you doing this stuff, but. Oh, hold on, it's Adam. Hello. What's up?
Such a stupid thing to beef over. At least to me.
I can go check real quick. Why? Yeah, let me go check. I'm talking with Indy and I'll go down there. Do you need it now or? Okay, yeah, I'll be there soon. Bye-bye. Okay, so they were just sorry to talk about, like, you don't want bring stuff to their turf. You know, like wars they're doing. They're like, don't do that. So they were setting out rules for them, but they don't want to follow that one rule about the flag. So then they got pissed, and they're fighting. There might be something going on there. Soon TM.
Okay. Soon TM.
Yeah.
Duly noted.
Not now. Hopefully not. To be honest, I really don't want them to because it's kind of pointless. It's just a flag, but you know, it's more of a respect thing instead of a the flag itself. I think.
There's like 4 ballas against
Also, that's only
DOMC.
more. They just more bite than more, bark than bite. To be honest.
To come back.
Hello.
You're good.
Oh, okay.
More bark than bite. Okay.
I forgot.
You were about to fuck around and find out.
Anyway, what I was saying before, Andy.
Uh-huh.
You gotta get with the program.
I gotta. I'll be back, guys. I gotta go to Lantern Night.
Okay.
We might be 42 by the time you get back. So just
okay,
if you want to keep yapping, just track me or whatnot.
Yeah, I'll track you.
Okay.
Look at dispatch. Look at your name compared to everybody else's.
Oh. I'm being homophobic.
You can just copy the flag on mine and then paste it in yours.
There we go.
Yay!
It is done. I'm no longer homophobic, says the bi woman. I wish there were bi-colors on these freaking bracelets, dude. That would be so nice. Because they have one, but it's like not quite the right shade of stuff.
Oh, 276 to the 60 on Eastbourne Way. If it's not BF 400,
Yeah.
yay.
Yeah.
I don't have trans colors either.
Yeah.
01376 same thing.
And then I tried to... Here, we've not got a patient. Just come with me. I'll illustrate. Okay, I wanted to wear... Let me see if I can find it.
Whiskey 13, 1042. Have a good night.
Good night.
Good night.
1323. Did you see that?
Wanted to wear this, but with the...
I'm good. I'm so good.
The bi-colors?
Say less.
What do you mean?
There is no way for me not to have a hole, like, around my shoulders.
Let me at him.
Even if my torso is fully covered.
Okay, Scrappy Doo.
Shut the fuck up. With love.
Try it all the way at the end of the rack.
Yeah, that's what I tried first.
Oh. Because I know that's usually the catch-all one.
Because if I wasn't wearing scrub pants, this one would be okay. But it's okay until you have to move it all.
Yeah.
So it's frustrating.
Plus your belly's kind of hanging out of the scrub pants.
Yeah, I know. Which, if I was gonna wear this, I wouldn't be wearing scrub pants.
Well, yeah.
But yeah, I tried that with so many different pairs of pants. I tried different shorts.
Yeah.
Stuff in the undershirts rack, stuff in the pants rack. All different things in the torso rack. I could not find a single thing to make that shirt work.
Well, I think it's time.
Yeah. Do you want to call on one or do you want me to?
I will.
Dispatch of Farley made it to transition to 6ly made it to.
Huge. Hell yeah.
Let's try to 10-6 Blackbird getting fixie car or whatever it is.
Ollie, are you okay?
Yes.
Something like that.
Yes, I'm cool.
Do I have to feed you a Red Bull?
Waiting for an opportunity.
Please, no.
Yeah, for clear radio
Already
traffic,
had
I
to.
get you.
I bet.
Are you okay?
We might as well not call 1042 on 19 because it's just us.
Yeah, true.
Mm-hmm. I might open pains for like an hour.
Send it.
Both doctors going off duty. I'll have Nancy.
Good night.
Good night.
Oh, before you clock out, can I get an ice pack?
Uh-huh.
I'm okay. I just forgot to drink some water earlier.
Okay.
I'm good. Thank you. Do you need ice pack? Are you okay?
No, I'm good.
Jessica.
That step. I knew it was
Gets
there.
you every time. Jeez.
I know.
Well, that's not sus at all.
The van.
Yeah, the nondescript gray van.
Yeah, it's okay.
Right
I'm sure
by
it's
the
fine.
spooky alley.
I'm sure
That's
it's fine.
perfectly fine.
It'll be fine.
Surely, surely. That wasn't my thought. My initial go-to was this.
Oh. Well. You've got my lethal.
Yeah, I got your lethal.
Okay.
Gasp, she was a Sugoi girl today.
Oh, so Silver left the truck at the little Soul location
Okay.
last night, which is fine. But it wasn't there. The local valets towed it to Alta. I'm thinking we just have to keep them in Alta until
Whatever the
local valets
valets
are
get figured out.
Yeah.
Yeah, that is perfectly fine with me. Do you want me to
So-
shoot that out in the Pains chat?
Yeah, if you want. I mean,
All right.
you, me, and Silver are the only ones that really take the trucks out.
Yep.
So. Oh, yeah.
There we go.
Awesome.
I got you, girl. Don't worry about it.
Thanks, girl. That sounded kind of weird. Okay.
Alright. Good night, Jess.
Good night.
Good night. Woo! I know. Are you okay? Because I'm good.
Yeah. Yeah, I'm okay. Are you okay?
Yeah, I'm good. I'm just flipping you off a little bit.
Oh, okay.
Just a touch.
That's fair.
I don't normally get reasons to flip somebody off. I'm just taking advantage.
Should we get out of this guy's way? Or just stay here?
No, fuck this guy. Okay, anyway, I'm headed to Alta. I'm probably gonna open pains for like an hour.
Okay, I'm gonna head home.
Alright, sleep well.
Okay.
Alright, I'm good on dispatch. I'm going to Alta. Actually, I did doctor all day today. I don't need to be the government. Did I just leave my key in that? Oh, cool. Nope, there it is. Perfect. Gonna use the restroom right quick. For a split second. And then I will... Oh, of course. I'm still gonna run to the thing. There's room for you to put your bike behind the truck if you want to. That way it's a little bit better hidden. Oh, this is hot wired. I'm gonna move this across the street right quick. It's hot wired and yep. I'm just gonna do that.
Okay.
Never mind. It stopped running. Ah well.
Yeah. Yeah, he barely did. Kinda, well. Honestly, you should do that and accidentally hit him. Put out, oh my god, get the box, put out a hit on him. Little box. Yeah, be like, hey, kidnap him and dispose of him.
Hello.
Oh.
Yo, we hungry.
I figured y'all came in pretty hot.
Yep.
There you go. There's our menu.
Oh, God damn it!
Ow.
God, oh, fuck! God.
I got a 2 and 2.
Hey, what's up,
Your choice.
Yeah, can do.
Hello to you too, Eddie.
Hi.
Oh.
One day I'm
God,
gonna
you look
shave
like
your
me.
mullet.
Wait, do you look like me? No, you said Oh my god, it's my clone.
Oh my god. He almost looks like me, but he's like an older me.
I'm gonna
What the hell?
be very displeased.
Yeah, I know.
It's just stress.
I've
I'll be
heard
very
this.
disappointed in you.
Like 60, I'm assuming.
Can I get the
Vince, you've
state
said
ID
that
for
to
your
me
order,
fuck?
please?
a lot of times.
15114.
No, but this is
28.
like I'm gonna go to the fucking
How old do you think
store to
Jeff
get cigarettes
Jefferson
and
is?
never come back type of disappointment.
How am I older than you? That's not.
You'll be back.
I mean, probably.
It's the stress.
It has to be the stress.
When we
What are
start
they
dyeing
doing
my
to you guys?
hair,
Of course, start dyeing your hair. That's if we stay young. Like Joey over here, his hair is like pretty.
we should go bald.
He just dyes it a lot.
No. God
Oh,
no.
wait, yeah, you hate bald people, don't you?
What do you mean I hate bald people? Okay, number one, I do not hate bald people.
One moment.
Oh, you fucking.
What the hell?
What?
Vince, the
was that one time though where you said, God, bald people are disgusting. We should just kill them all.
Okay,
Brian
accusations,
Bold, the enemy of the
allegations.
bold.
All right, there's your food on the tray for you.
What? Is this black? Are you blackmailing me right now?
It's not blackmail. It's the truth.
Blackmail,
It's the
hey.
truth. Yeah, blackmail, eh?
Can't be blackmail. This
What's he getting out? What are you getting out of him? Out of the blackmail there?
Yeah. What is he?
Oh god. Okay. I'm fucking starving. I'm getting distracted. Gonna get a 2 and 2, some garlic bread, and some rhubarb.
Yep, can do.
I'm just gonna eat garlic bread all day. What the?
What can I say? I'm a slut for garlic bread. Okay.
All right, would you like any honey poured over your drinks?
And no, it's fine.
Okay, what's your state ID?
16579. Big bet.
Yeah, all right. It'll be about a minute, then I'll have that on the tray for you.
Okay.
Did I suddenly go deaf, or is just nobody talking? Alrighty, Vince, got your food for you.
Oogie. Thank you very, very much.
Yeah, no worries.
Have a good day.
You too.
Watching you, Eddie. What? This? That's my rebuttal, okay?
Dr. Indy,
Hey, what's up?
I got something for you.
Okay.
Here you go. I don't know how much room you have on you, but this is stuff that you can hand out. Courtesy of the state. You know, maybe you don't want to hand it out to every single customer, but you know, I'm sure you can figure out some way that you want to do it.
Nice. Okay.
There's going to be a few more here, so give me a second.
Okay, I've
There
run
you
out
go.
of space.
Okay, well, I can
give
hold these
me-
last.
Yeah, give me 1 sec here. Oh, I see.
Here you go.
Gotcha.
There you go. I'm sure you can figure
Awesome.
out some way to hand those out, you know, in a way that is fitting and get them to the people that would appreciate them and all that.
Nice.
Okay,
I absolutely can do that.
perfect. Anybody need food while we're here?
Oh, I always have to get a lasagna in the spritz when I'm here.
Yeah, so a lot has happened.
Hey, Andy.
Howdy, howdy.
How you
What
doing?
can I get started for you?
Oh, you know my order.
Still haven't stopped talking.
Lasagna and a spritz, but how many?
I'm going a little light today.
Okay.
I'm going a little light today. I gotta celebrate.
Wait, I also want one.
I managed to talk to Ragnar finally.
Yeah.
They're looking at co-owner of Black Q.
No way.
I know. It took a little while, but we got here.
Private section.
Hmm.
Yeah, I'm looking forward to it.
Gotcha.
And Gemini towing through the fucking gauntlet down, so now we're pretty motivated to just wipe the fucking floor with them.
Nice.
basically gonna go ahead with piece of history. And
Yeah.
approve them. 'Cause you're already.
Out of curiosity, you want a job there, or you still good with B&B? I told Santi pretty bluntly he's going to work for me at Lot Q.
Give me some time to turn my resignation into Bruto.
That's
Because Bruto's been good to me.
He's a good man.
As congratulations for Lot Q, your lasagna and spritz is on me today.
Oh. Oh, thank you. Oh.
Yeah, I got you.
Ended up being a fucking 3-hour conversation with this guy.
Oh,
And
really?
on top of it, I had 4 hours of interviews with people wanting to work at Lot Q.
Oh, jeez.
It ended up being all of Death's Omen.
Yeah, I saw Fauna and Holly had joined up.
Yeah, I wasn't ecstatic about half of them joining. But what can you do? Ragnar was like, yeah, no, I like him, and I'm like, we could tone it down a little bit here. Surely we could tone it down just a smidge. They don't want it to be the lot do.
Yeah. Yeah, you'll definitely need to get some variety up in there.
Hello.
Yeah, so I gotta talk with a few other people, just sort of see where they're at. But yeah, no.
Nice.
If you ever want to, just let me know. Take as
Yeah.
long as you need.
I'll be honest with you, Joey. I don't
Yeah,
work
yeah.
toe
Goodness.
a ton because I'm so busy with hospital stuff.
No, I know. I even told Ragnar that. I said, there's one person I want to hire, Indigo Fera. Honestly, she don't really do too much towing. She just likes to go on little tow dates with Santiago Palermo. He's like, oh, that's so cute. Yeah, she's hired.
All right then.
Yeah.
Yeah, I'll send my resignation into Bruto,
I don't know.
or see if I can catch him in person and just let him know, because he's a good guy.
He's a good guy, trying his best.
Yeah.
Like he's not playing type shit.
Well, looks like we gotta go talk to a business and potentially shut it down.
Which one you shutting down? If you can tell me.
We are looking to mechanic shops up north still.
Oh, like Sandy Pump and Dump? Yeah, that thing's not been open in I don't know how long.
No, not at all.
I know Skyla was employed there for like a little bit.
Yeah.
Let's see, where am I?
They sort of just hired her on. It was like, oh yeah, you got a job by the way. So. And she's like, oh, yay! But then never worked a day in her life.
Yeah, that's 99% done. There's a couple things that aren't pushed yet. It's in the business council private area.
That makes sense why Chris.
Little hidden. And then we also have to change the food truck guidelines. More to be like food truck legislation, kind of.
What the hell? What's wrong?
How do we want to go back to
You bumped into me.
The government doesn't want food trucks operating randomly at random locations unless it's their location.
Do I want to fight?
So unless it's that or it's a hub.
Do I want to
basically
fight
get
you?
people into semi-permanent areas, or they have to go to hubs. There's very select few hubs.
Okay, do we have a list of the hubs?
One of these
and stuff?
days.
Tackle
One of these
Street.
days you'll get in these hands.
And Wisconsin Plaza are in the city. We'll talk it.
Of what, like everybody? Except for Benji?
Oh yeah, you've won every fight.
Lost the only fight.
I had the thing
taken
created
of
today
Lost.
where we have the roles, as you know,
Only
you
lost a bit.
assigned the business
And that was
owner role to a bunch of people. That's also going to be a thing we need to remind these people going forward.
I don't know.
Business council members need to alert us of if there's ever a new business owner, because we need to then ourselves add them to the business owner role.
was wondering, do you need it to see, like, the entire dashboard thing for it? I mean, I'm assuming so, but I mean, like, for example, I can't see it right now.
I'll be honest here, I really don't know what the tag is supposed to show.
Don't. Here's the thing about the business owner. Don't ever use that role. Let's get in the car.
Love you, Indy.
Y'all stay safe.
Fuck you, Silva.
What the fuck? Bye, guys. What the hell's wrong with that?
I wish they would have stuck around a bit longer. I could actually hear what he was saying.
Me too. I
I
wanted to
already texted and warned Jess.
Well, what?
They were talking about food truck legislation, where the food truck will need to stay in a semi-permanent location, or where a future brick and mortar will be, or a central hub, and they're going to denote where the hubs are. So we couldn't open up here unless we decided this is where our kitchen is going to be eventually.
Interesting.
I'm actually not a huge fan of that, because the whole point of a food truck is to be a mobile kitchen that could open anywhere it wants.
To, like, get all the food trucks to be brick and mortars.
Yep.
I think the transition that's over.
Yeah, I'm pretty sure that's what they're trying to do, but also I think food trucks are unique, and we shouldn't be getting rid of them overall. That's just my opinion.
I don't know.
Again, I could be shooting the shit and it ends up being a really good thing, you know, who knows. But that also puts some extra pressure, because if we pick a shitty location, we're gonna be stuck there.
But aren't they gonna do like little hubs?
Yeah, hubs, but it'll be... I heard one is like down in on Tackle Street.
Mm-hmm.
And then who knows where the other ones would be. Like one up north and then one down south. So it would be good if we could just get our box kitchen somewhere.
I'm trying to go bitch.
Then go bitch. I was gonna only open paints for an hour today anyway. And I've got 40 more minutes before I close. Because there's really not a lot of folks around right now.
I got some. Oh my god! You know what I was noticing? Which is just me saying tea because I'm bored. I was talking to Tommy, just like, you know, yapping, because we always just talk on the phone.
Yeah.
And then I realized that, oh my god, I actually have this guy wrapped around.
You didn't know that already?
No, but like it dawned on me then more. I feel like I've noticed, but then I noticed and I was like notice. I was like, whoa.
Yeah, girl, you've got him hook, line, and sinker. Have had for a while.
And he acts like, no, it's okay. Like he tries to act all nonchalant. But then if
No
I'm
burn.
actually upset, he's like... He tries to fix it instantly, it's so funny.
That's kind of cute, actually.
Whenever I'm hurt, he's actually like, are you okay? Are you okay? Are you okay?
Mm-hmm.
Yeah. Like when I hit the rock when we were by the fishing. He was, I could hear him like through the speaker of my phone.
Yeah.
So I was talking to him. And he was like, Sylvie, are you, is it Indy there? Are you good? Tell me you're good. Are you good? And so I was like, I don't know if he could hear me, but I think he could.
Right.
I think he heard you, you know, through the phone. And I was like, Indy, yes.
Oh, I see.
And he was actually like, oh, okay. That's good. It's kind of funny. No, it just dawned on me today. I don't know why.
Yeah, it's kind of cute or whatever. I am glad he cares about you that much.
You actually think it's cute?
Don't get me wrong, Silver. I still don't like the guy. But so long
You know
as
what's funny?
he's...
He always asks, he's like, why doesn't he like me? Why didn't she like me? He's like, I don't get it. Like, I did nothing to her. He's always like confused about it.
Did nothing to me. Not directly.
Yeah.
That's what he didn't do.
The report, right?
Mm-hmm. 2 people lying there in pools of their own blood. And you don't... It's not even important. It doesn't matter. That's why I don't like him.
I just explained to him. He was like, I don't get it. He wanted to know why I ate them. So I'm explaining a little bit. I think is the one situation you were at with each other. Like,
The one time I've ever had... I didn't even really have an extended conversation with him, because guess what? I was unconscious. In a pool of my own blood.
and he said, he was like, oh, I was, I don't know what he said. Something about like he had to go help a cop right after that. Like, but after that situation. So he didn't write the report, but then Dallas did, and I was like, I don't know.
Yeah.
Like,
Cool.
I don't know. I don't know what happened. I wasn't there.
Look. As long as he treats you right, we won't have issues. But just because we don't have issues does not mean I need to like the guy. I treat people every day that I don't like.
That's true, you do that.
But guess what? It's my job to be impartial and treat them anyway. But like I said, as long as he's treating you kindly, as long as you two are having fun being together, that's the important thing. And he and I will not have issues.
You know what I've noticed?
Hmm.
Other because Ren did this. Like she was like, "Oh, I hate him because he pulled me over or some shit."
I don't give a fuck if he pulls me over. That's his job. If
Yeah.
I'm speeding, I'm speeding.
Yeah. That was like her like thing that was like 3 over, and they get angry because he gets pulled over. Right? And I'm like, yeah, he's a little petty bitch.
Yeah, he is
He'll
petty.
pull you over for he'll pull you over for everything, but most of the time he looked it up and she didn't even have a ticket from him, and he was like, I never spoiled her. Like, why does she hate me? And I've noticed that people just like jump on the bandwagon of hating this one person because yeah, he's petty bitch and he does it. Like, he'll do it again, to be honest.
Yeah, he will.
But like they just it's like if your friends don't like him over that, I don't like him, and I don't like the whole. Not even with him, just like in general.
You just don't like
you
bandwagoning.
You not liking somebody just because your group or your friend doesn't like them. You
Mhm.
haven't experienced that person. You haven't met them, and you just don't like them. I don't like that. Like, that's so weird to me.
Yeah.
That's like what? Like, you can't make your own decisions or stuff like that.
Listen, that's just... In part, it's gang mentality. Because...
Yeah.
If one person has beef with somebody, then it becomes a gang issue. Which is stupid to me. And... I mean... I know I'm quote-unquote not part of a gang. But... I have friends. I have family. And normally if I voice an opinion, my friends and family will listen to that and it will kind of cloud their perceptions of somebody. Yeah. And sometimes they take it too far and my opinion becomes their opinion. Instead of meeting the people and maybe having some caution, but forming their own opinions of them. Like, you've had a bad experience with Bree from Death Omen. I've had nothing but good experiences with Death Omen.
Yeah.
And it's okay that you don't like them. That's your opinion. And you're not gonna hate me for liking them a lot. And I'm not gonna hate you because you're not a fan of them.
Yeah.
It just means I might ask you why, but you explained it, so. And based on your personality and Bree's personality, that clash makes a lot of fucking sense.
Also over something petty, but...
Yep.
It's just the way they talk. I this weird entitlement, this weird like superiority. Superiority they have over somebody else. I'm like, who the hell are you? I was like, what have you done to like earn that shit? Like, that's the thing.
A lot.
Like, if you earn that shit, yeah, sure. But if you haven't, then like, why you all talk? That's what pisses me off.
Yeah. And...
Alright, love you.
Hello.
Hello.
There's our menu for you.
Can I get a 4 and full, please? Can I get spaghetti and meatballs and Alfredo, 2 cheesy garlic breads, and we'll go full rhubarb spritzes, please.
Yeah, absolutely. Alright, would that be cash or card for you today?
Card, please.
Alright, could I get a state ID?
19360.
Alright, I'm getting that started for you.
Thank you.
We got some things to hand out from the mayor's office. Are you... This is a weird question to ask. They're all kind of catered to different sexualities and things. Do you have any particular one you kind of feel more like, I guess? Because we have a standard rainbow one, then we have one that kind of corresponds to all the different flags.
I don't really have a specific one, so I'm gonna just say the generic rainbow would be the safest bet.
Yeah. I never really realized how to ask if somebody would like one without just being like, tell me what you are.
Yeah, I mean, some people are very private with that.
Yeah, exactly.
I need to put some stuff away real quick. 2 seconds.
Yeah, you're all good.
Also, I saw Rex's shop.
Yeah.
Hold.
Okay. That's for me. That's for Indy. Alrighty, there's your drinks.
Thank you. You guys have a lovely day, okay?
Yeah, you too. That is the most awkward ass thing I've ever done. I swear to God.
Oh my god.
That's the one downside to this location. There's no trash cans.
Oh yeah, I was gonna say, I was like, oh my god, I think I was talking to Tom, and oh my god, I like the Rex's shop.
Holy
dinosaur
fuck.
week. What?
That guy just tipped me $850.
Oh my god. What the hell? Why didn't he tip me $850?
We'll put your name on the side of the truck and take some orders.
The hell?
What the hell? That's wild. I think he might have accidentally put an extra 0. Because that's way too much.
No. How much was
it was a 4 and 4, so it was $180.
I don't know. Did Jess go bed?
Yeah, she did.
Oh. What did I say? Oh yeah, the dinosaur. We were talking about the dinosaur because we were looking at it on the entrance. And I was like, oh my god, the little green one with the bubble wrap and all of it.
Yeah.
I was like, that's me because I always get hurt.
Same, I bought one. It's so freaking cute.
It's so cute. And you know, today he was like, where are you? And he gave me one today. But it's so cute. It's so cute. He's like, that's you. And he gave it to me.
Honestly. Also, if you want one of those, Pride Pops, feel free to take one.
I have, like, all of them on me right now.
Oh, gotcha.
Like, if you could rob me.
I took one of the Buy Pride ones from Inside Pains.
Yeah, they're cute.
Yep.
I don't know where to put them.
I don't know. I'm gonna put a sign up that says, like, ask about our Pride Pops or something. Because the way I asked that officer was not it.
It was kinda awkward. It was kinda awkward. 'Cause, 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 'cause just say, do you want
Red,
a pride
orange,
cup?
yellow,
We have
green,
different
blue.
flag types. And see what they would say. I think they'd be like, oh, okay, I want this one.
Yeah.
Hello? Hello, what's up? Yeah, you hate me? I knew it. I can't believe you ignored my call. Duh. I can't
There we
believe
go.
you ignore me like that as well. I think you do. No, that's my line. That's my line. That's me, dude. That's my line. Stop taking my line. No, that's I say that once. Looks I say no. No. I was gonna say I'm going eat. Yes,
Going
I mean
eat.
I'm going home because it's closer. What the? What the heck? What the heck? This guy said good. Actually, I might go Sandy. Yeah. Even Interesante. Interesting. Okay.
38
Since it's
minutes.
closer, I might just go there, honestly.
You're such a stirrer, I swear to God.
What do you mean? How am I stirring?
You're such a stirrer.
Indy said I'm a stirrer. Is that true?
You're such a stirrer. What do you mean?
You can't both agree that I'm a stirrer, and that's wild. I can't have both people around me say that I'm a stirrer. He also said I was a stirrer, Indy. Can you believe that? I'm not.
Wow. For once we agree.
I'm not a stirrer. How am I stirring?
You were like,
how am
I think I might go up to Sandy tonight. So that gets me like, oh, Silver's gonna come home. And then you're like, actually the apartment's is closer. And then so that's stirring towards the Leica. So you're just a stirrer.
She's clocking me. She's clocking me. Actually.
Girl, I've been clocking you since day one. What the fuck?
Shit. Honestly, she's my biggest op. She probably clocked me.
I'm your biggest op. I'm your fucking sister. Of course I'm your biggest op.
She said, of course I'm your biggest. Oh my god. That's wild. I believe she
Am I
did that to me
wrong?
right to my face. Can't believe it. Okay, I'm going eat. Bye, bestie. Going eat. Night night.
Bye. Freaking Volpica. With Cinder.
No, you have the wrong number. Or maybe you don't, handsome. Me,
is this language?
Yoo-hoo! Hey, buddy!
What does the roof of this look like?
I don't give a fuck. You keyed my car.
Honestly, could be an insanely cute rooftop location. Is there a way to get... Yes, there is. From around that back alley. I think that's Fang.
Hi, Indy.
Hi. Oh, hi, Fang. How you doing?
I'm doing pretty good. How are you?
Doing good.
What's a
You
pride
come for
pop?
something to eat? Oh.
Yeah. And yes, I did. What's a pride pop?
So the mayor's office came through. There's a bunch of different flag-colored lollipops that we can give out.
Oh.
Mm-hmm.
Cool. Ooh.
Yeah.
Okay. Then can I get 2 and 2 and one of the pride pops?
Yeah. Do you have a specific flag you'd like?
I guess the trans flag.
Okay. Remind me, are you vegan or vegetarian?
Vegan.
Vegan. Okay. I'll make sure to use the vegan cheese then.
Thank you.
Yeah, yeah. Alright, would that be cash or card for you?
How much is it gonna be?
A 2 and 2 is 85.
Okay, put 85 in here. You know, I'm just gonna put 100 in here because I do not have anything smaller than hundreds.
Oh, okay.
Howdy.
Alright, there are your 2 entrees, and then I'll have your drinks here in just a second.
Thank you.
Yeah, no worries. There you go, there should be the rest of it.
Oh, so much. Have a good one, Indy.
You too, Fang. Take care. Hello.
Yeah, hello. How's it going?
It's going good. How are y'all doing?
Can't complain. Can't complain. Lucky, what are you gonna want?
I don't even think I need anything. I'm still good. I don't think I'm gonna be up much longer.
All right. Can I get into it too?
Mm-hmm.
Could I do 2 lasagnas, and 2 Negronis?
Yeah, I can do.
State ID is 18970.
18970?
Correct.
There you go.
I go through.
Yes, it did. Alright, there are those 2 lasagnas. And I'll have your drinks up here in just a little bit.
Awesome.
My shoes are wet.
Well, yeah. I mean, we went swimming.
Yeah, but now they're all like soaking wet. gross. Gonna get trench foot.
Oh no.
Change your socks. Change your socks.
Yes, please
What
go
if these
change
are the
your
only
socks.
socks I own?
And go buy more socks.
There's your drinks for you.
Thank you.
Yeah, of course.
What do I do about my shoes? Just because my socks are dry, my shoes are still wet. I'm still gonna get trench foot.
What? You don't need romance to be the main. Is that supposed to be like a romantic or something? I'm gonna have to educate myself on some of the. I know that one. I know that one. I know that one. I know that one and that one, obviously, because I made Indy buy. I think I know what that one is. I know what that one is. Okay, aromantic. Okay. Okay, so in order. Aromantic, asexual.
What's up, Sharon?
Oh.
God damn it! Hey, Francine, how are you, girl?
Intersex.
Oh no! You guys get into a fight? Mira, you tell that piece of shit that pre-op or post-op, you're still all woman, okay?
I think
You're beautiful, honey. Bye.
gay, trans, bi.
Hey!
Hi there!
Okay, there we go. Now that's in there. Of course her gun had to go. She'll do the true southerner thing and toss it in the back of her pickup truck.
Oh yeah!
That is one thing I needed to make a note of. No, I won't make a note of that until...
Yeah, he's pretty upset, asking a lot of questions. I think his agent is in his head. Well, did you move some of the money in your other account to cover your losses? Well, you better do something. We might lose our client. We can go to jail. This conversation never happened. Ever.
Yeah. I made a mistake on the Martin Pierce report. Because I should have contacted PD to get his statement once he was awake. But also, he's still in the ICU. Let me make a note of that to just kind of cover my ass.
You're like not good looking or famous enough to walk into people, okay?
Oh, I'm sorry. Hello.
I just turned up.
Hi, let me get you a menu.
Thank you so much.
Of course.
How's your day going?
It's not going too bad. Been a little bit of a hectic one, but not in a bad way.
That's good.
How about yourself?
Could I get... Ooh, 1 second. Let me
You're
get
good.
a rhubarb spritz and then also a cheesy garlic bread. And other than that, my day's just started. So, pretty good so far.
Well, nice.
What was your name?
Oh, I'm Indigo, but most folks call me Indy.
Ah, nice to meet you, Indy. I am Joy.
Nice to meet you too. Always a pleasure to meet a new face.
Yeah, I was doing taxiing for a while because that was kind of my thing as I was going around lockpicking or whatever, and
Mhm.
then giving people lifts whenever they would call because not many people call you anyway. And then an officer pulled me over for driving through red lights, and then she realized I didn't have a CDL license, but I didn't even know I needed one of those. And so now
Oh,
I can't do taxiing at least. Well, I could, but I'd get in trouble for it.
gotcha. Would that be cash or card for you today?
Card, please. My state ID is 284 at the end.
Gotcha, gotcha.
But then also, I don't know why I care, and I'm actually not driving because I do illegal things all the time.
Mm-hmm.
So then I'm like, why do I care about this particular thing?
Sometimes if you care about something, you want to make the effort to do it right, I guess.
Yeah, I guess.
Alright, I got your food on the tray for you.
Thank you so much.
Yeah, of course. You take care.
You too.
Why is the spacing so weird?
Oh my god, there's no way. I just did a circle. Yeah, I was kind of going around trying to find something to do. I was gonna lockpick a couple cars, and then I ended up doing a circle. So here I am.
Oh, gotcha. I
Yeah,
know
now
that
I'm
one
gonna head
got
in that
lockpicked
way.
earlier, but let's see.
Yeah, because I know those ones I can lockpick, but I think I'm gonna head
Mhm.
in that direction this time, and that way I won't end up back here.
Gotcha. Good
Right,
luck.
see you.
See ya. I'm curious what this looks like, so I'm going to look it up. Do I be a little shit and nominate somebody? I could do a very, very, very bad stir and nominate Jess. Because she's single.
Honey, we're grabbing drinks tomorrow. No doubt.
God, this is such a cute little area. Okay. Yeah, close enough.
I was supposed to go to the beach, but they completely shut down the Elysian Fields freeway. Oh, all the surface roads were fucked because of it. Good one.
You're really on to something.
If I just kept going straight, I would eventually have gone that way. Okay. Kuma.
Any of the good ones? Scouts. Cool for that.
I was about to say 90K. I
Yeah.
would have just fucking said to hell with it.
30k
Hello.
gross. It's a 20% discount on 30.
So what were you looking to get today?
What's the one of those
Benefactor
white,
Imperial utility van.
one of those white
Gotcha.
vans
Okay.
to fill with candy?
Oh my god.
5733. All right, and what is your state ID?
18948.
All right, then let me do
That's
some
a
quick
6,000
maths.
6,000 discount on it. Or you still like 26,000? I'm too broke for that. Ooh. I only could sell my other car that
Okay,
I
I think
don't
I did
want.
my maths right. All right, it should be around the back for you. Let's go see.
I appreciate it.
Yeah, it's no worries.
Actually, wonder if I can put it in the next
Sounds right there.
Yep. If you're
Yep.
not able to pull it out,
Oh wait, maybe it's.
oh, there you go. All right, and your registration should be in the glove box along with your keys.
All right, thank you.
Yeah, no worries.
then don't care.
Yeah.
All right.
I'm
Is there
broke
anything you
otherwise.
fellas need help with?
No, I'm too poor.
That
We're
is fair. Me too.
we're kind of just harassing Dusty.
Yeah, that's fair.
I heard he was here.
Nice.
Okay. Have a nice day.
Y'all too. Take care.
Take care.
See, this is the gauntlet. Because it just looks mean and I love it. Because it's based off, like, Mustangs, I'm pretty sure. Oh my god! I need to do a repo date. Because that is wild to me. 1% of 20k, which is like not a ton. Did I park that? It's to that time of day where... Okay, yeah, it says drive. We're good. Yeah, rah. Treatment for drug addiction. Is that how you spell physicians? because it's my bedtime, and I'm going to bed. Petit miss.